Thank you for listening to Depictions Media Radio. Welcome back to Policy and Rights here on Depictions Media Radio. I am your host, Michael Clogs. And this week we're going to hear about a lot of different things happening in our area, from COVID-19 to relief efforts in Afghanistan, to how Canadian and British Columbia is trying to help businesses get relief and help people be able to earn a paycheck or support, because the businesses that they actually work in are on a lockdown order. So with the WHO last week, Dr. Tedros reported more than 15 million new cases of COVID-19 were reported around the world, and while it's far more than any other time in the pandemic, there are some good news to be had with what is being seen with the new Omicron variant and the spread of COVID-19 around the world. So in British Columbia, they have come up with a new relief grant for businesses, and businesses have been able to apply for relief during this past week. There are some questions as to why that relief grant was released at the end of what would term to be the closure order for said businesses, such as nightclubs, health clubs and gyms, and certain types of restaurants and bars. And in the UN, we'll hear from the Secretary General about Afghanistan and what is going on in Afghanistan, and other relief things that are happening around the world that are working well, and some that are not working so well because of government blocks. And while we won't hear a statement about this, the United Nations is trying to urge Iran to halt executions, especially because of a juvenile offender where the offender stabbed to death a person at the age of 17, and of course they're now just over 21, and the government of Iran is looking to execute this person, and they're trying to find a way to halt this, because when they originally committed the offense, they were underage and a juvenile. And another unrelated to the segments on this show, British Columbia strengthens mental health crisis lines. These lines are open in British Columbia in order for people to call in, because mental health is important, and it leads to other things happening, and it leads to other medical responses that could be prevented with a phone call to an operator to help someone feel a little better about themselves. And in the United Kingdom, there is a bill being looked at that could place discriminatory acts against people looking for refuge in the United Kingdom from other governments, that it could seriously undermine protection of human rights of trafficked people, including children, and increased risks of exploitation faced by all immigrants. We'll also hear from the public health officer for Canada, who gives a report on what is happening across Canada with COVID-19, and what are some of the risks of the Omicron variant, and how it could have effects on hospitals and healthcare system in Canada. We have heard, of course, in different areas in Canada where there are delays to the 911 system, and in Alberta there was a case where because they were being asked to dial 811 first and then call 911 after approval for 811, that that there was up to a 5-hour delay in actually getting a person treatment for COPD, where that person did later on die in the hospital. So in British Columbia, there was a delay in getting help to someone via 911 after they have fallen on ice and concrete because of possible staffing delays. We also in British Columbia, the maternity ward at one hospital has been diverting patients because of lack of pediatricians in the hospital. So there's a lot of staffing problems with the hospitals in several provinces across Canada, and there needs to be more questions answered about what is actually happening with that. There were also questions to be answered about surveillance of several, a good chunk of the population of Canada downloaded an app. It was supposed to be a contact tracing app for COVID-19, and that's the cell phone data of those users has been used for possible other things outside of COVID-19, and there are questions to be asked in Parliament Hill about what is going on with that and why this app was created in a way to capture the data that it did. So let's move on to the segments, and we're going to hear segments, of course, from the UN, the WHO, the Pan American Health Organization, Canada health officer, and different parts of British Columbia. So let's listen, and we'll get back to you at the end.
Thank you for listening to Depictions Media Radio.
Plug it in. And welcome back, everyone. The next segment is John Brassard of the Conservative Party and critic for the ethics in accountable government, as well as Pierre Paul Huss, data from millions of mobile devices to understand travel patterns during the COVID-19 pandemic. While the House of Commons is not scheduled to resume until January 31st, the opposition parties are calling for an ethics committee to convene emergency meetings to investigate the matter. Basically, what the National Post actually broke this story with 33 million cell phones were tracked, and the data collected because they had uploaded the government's COVID-19 app. The government was secretly collecting the data without the user's knowledge, and that breaks ethics rules. And an explanation should come from this about why the cell phone data was collected, what the intended use for that data was, and was it, if it was simply to track how COVID-19 was spreading across Canada, then why the secrecy about how this data was collected? There's questions that need to be answered, and the next question after that is, with the vaccine passports, which may or may not be discussed in this next segment, should we be questioning, are they tracking that data again with the vaccine passports, because it is another app that is actually loaded onto our phones, and are they tracking again movements, and why are they tracking the movements, and what should we know about why cell phone data and our movements is being tracked? So let's listen to John Brassard and Perry Paul Huss as they discuss with the press about this current happening with.
I'll be delivering some remarks this morning, followed by my colleague Pierre-Paul Huss in French, and then we'll be happy to take your questions. The Public Health Agency of Canada confirmed media reports just before Christmas that it had secretly accessed location data for 33 million mobile devices to monitor the movement of Canadians during COVID-19. That number represents roughly 87% of the population who were spied on without any knowledge that the government was accessing their data. Public Health Agency of Canada officials were forced to admit this had occurred after a request for proposal was published with a call for interest in continuing a program of collecting data for up to 5 more years. There are a few points I want to make on this. First, no one knew that PHAC was collecting their data, and for what purpose. So, why was it done in secret? Who authorized it? And who was this shared with? Second, the request for proposal to continue this program appeared on December 17th, 2021, the day after Parliament adjourned for the holidays, and is set to expire January 21st, 2022, 10 days before Parliament is set to return, conveniently leaving no time during this period for questions to be asked by parliamentarians before it is too late. Third, what measures are being put in place to protect de-identified information from being re-identified? It should not be lost on anyone that PHAC's request for proposal is being undertaken without any indication that this was about to occur, with no ability for parliamentary scrutiny to determine what this information has been used for, what outcomes the agency and by extension the government is hoping to achieve to mitigate the damage being done by COVID in our communities, and what protections are in place to ensure that the privacy of Canadians has been and will be protected under this program. As David Lyon, author of Pandemic Surveillance and former director of Surveillance Studies Centre at Queen's University, noted, as have privacy experts and advocates, the pandemic has created opportunities for massive surveillance surge on many levels. not only for public health, but also for monitoring those working, shopping, and learning from home. Lyon also stated that there's evidence coming in from many sources, from countries around the world, that what was seen as a huge surveillance surge post 9/11 is now completely upstaged by pandemic surveillance. Last week, I wrote the Canada's Privacy Commission to investigate the reports that have surfaced and the request for proposal. I asked that an investigation be launched into the fact that PHAC tracked and collected mobile data of Canadians without their knowledge and their plans to continue this practice for up to the next 5 years. It's uncertain to me and many others whether the Privacy Commission was even aware that this was occurring, because in a report in the National Post, the Office of the Privacy Commissioner said, and I quote, "It is following up with PHAC to obtain more information about the proposed initiative." This gives us every indication that the OPC was not even aware of what PHAC and the government were doing and what they planned to do. This causes us great concern, as it should every Canadian. This morning, 4 members of the Ethics Committee, including Vice Chair, Bloc Québécois MP René Villemure, wrote to the Chair of the Committee, Pat Kelly, to ask that a meeting of the Ethics Committee be immediately convened to study what has occurred during this surveillance and to understand better the request for proposal that expires on January 21st, 2022. As I said in my letter to the Commissioner, Canadians expect that their elected officials will ensure that there is appropriate oversight for any such program that may be required, that there is data rendered permanently unidentifiable and is only collected for as long as is absolutely necessary. It is vital that we do not allow the COVID response to create permanent backslide of the rights and freedoms of Canadians, including their fundamental right to privacy. Et maintenant, j'invite mon collègue Pierre-Paul Housse à la parole. Pierre?
Merci, John. Bonjour tout le monde. Bonne année. Donc, l'Agence de la santé publique du Canada a confirmé dans les médias, juste avant Noël, qu'elle avait secrètement accédé aux données de 33 millions d'appareils mobiles pour surveiller les déplacements des Canadiens pendant les périodes de confinement en lien avec la COVID-19. Ce chiffre représente environ 87% des Canadiens qui ont été espionnés sans le savoir. Les responsables de l'Agence de la santé publique du Canada ont été contraints d'admettre que cela s'était produit après la publication d'une demande de proposition pour entreprendre un programme de collecte de données sur une période de 5 ans. J'aimerais soulever quelques points à ce sujet. Premièrement, personne ne savait que l'Agence de santé publique du Canada nous espionnait. Personne. Deuxièmement, la demande de proposition pour poursuivre ce programme a été émise le 17 décembre 2021, le lendemain de l'ajournement du Parlement, et doit expirer le 21 janvier 2022, 10 jours avant le retour des députés à Ottawa. De plus, les parlementaires ont été exclus du processus sans aucune possibilité d'étudier cette histoire pour déterminer 3 choses. Premièrement, à quelle fin ces informations ont été utilisées? Quels résultats l'Agence, par extension le gouvernement Trudeau, espère obtenir pour atténuer les dommages causés par la COVID-19 dans la communauté? Et troisièmement, quelles mesures sont mises en place pour protéger les informations dépersonnalisées contre toute réidentification? Comme le fait remarquer David Lyon, auteur d'un ouvrage sur la surveillance en temps de pandémie et ancien directeur du Centre d'études sur la surveillance de l'Université Queen's, ainsi que plusieurs experts, la pandémie a créé des opportunités de surveillance massive à plusieurs niveaux. Non seulement pour la santé publique, mais aussi pour la surveillance des travailleurs, des personnes qui font leurs courses et suivent des cours à domicile. Des preuves nous parviennent de nombreuses sources de pays du monde entier que les énormes poussées de surveillance après le 11 septembre 2001 sont de la petite gomme comparé à ce qui se fait actuellement pendant la pandémie. La semaine dernière, John a écrit au Commissariat à la protection de la vie privée du Canada pour qu'il enquête sur les rapports qui ont fait surface et sur la demande de proposition. Il a aussi demandé qu'une enquête soit lancée sur le fait que l'Agence de santé publique du Canada a suivi et collecté des données sur les déplacements des Canadiens à leur insu et qu'elle prévoit poursuivre cette pratique. Je ne suis pas certain, comme beaucoup d'autres, que le Commissariat à la protection de la vie privée est au courant de ce qui se passait, car dans un rapport publié dans le National Post, le Commissariat a déclaré, et je cite, Il a fait un suivi auprès de l'Agence de service de santé publique du Canada pour obtenir plus d'informations sur l'initiative proposée. Donc, ça nous donne tout le lieu de croire que le commissariat de la vie privée n'était pas au courant de ce que l'Agence de santé publique du Canada faisait et que le gouvernement Trudeau faisait et de ce qu'il prévoyait faire. Cela nous préoccupe grandement, comme cela devrait préoccuper tous les Canadiens. 4 membres du comité d'éthique, dont le vice-président, le député du Bloc québécois René Villemur, que je salue, ont écrit au président du comité, Pat Kelly, pour demander qu'une réunion du comité d'éthique soit tenue dans les plus brefs délais afin d'étudier ce qui s'est passé pendant cette surveillance et de mieux comprendre la demande de proposition qui expire le 21 janvier 2022. Comme l'a dit John dans sa lettre au commissaire, les Canadiens s'attendent à ce qu'il y ait une surveillance appropriée de tout programme de ce genre, à ce que les données soient rendues impossibles à identifier et à ce qu'elles ne soient recueillies que lorsqu'elles sont nécessaires de façon absolue. Il est essentiel que nous ne permettions pas au gouvernement Trudeau, sous prétexte de réponse à la COVID-19, de créer un recul permanent des droits et libertés des Canadiens, y compris leur droit fondamental à la vie privée. Merci. Prendre vos questions?
On commencerait les questions dans la salle.
Oui, bonjour. Laurence Martin de Radio-Canada. Bonne année.
Bonne année.
Sur un autre sujet, le ministre fédéral de la Santé, Jean-Yves Duclos, vendredi, a dit qu'il pensait que, selon lui, là, on n'aurait pas le choix éventuellement d'en arriver à la vaccination obligatoire au Canada. Est-ce que vous pensez, vous aussi, qu'on n'aura pas le choix d'en arriver là? Est-ce que vous êtes favorable à cette idée-là?
Merci pour la question. Premièrement, il faut se rappeler que ce que M. Duclos, qui est ministre de la Santé du Canada, a fait vendredi sont des propos très incendiaires. Parce que d'arriver comme ça sur une opinion personnelle et de prétendre en disant les provinces devraient ou devront faire la vaccination, c'est des propos qui ne sont pas justifiables de la part du ministre fédéral. De l'autre côté, nous, du côté conservateur, on a toujours été clair qu'on favorise au maximum la vaccination, qu'on encourage fortement les Canadiens à se faire vacciner, que c'est le meilleur moyen de sortir de la pandémie, c'est d'être vacciné, mais c'est pas en ayant des propos incendiaires qui provoquent des tensions qu'on va arriver à ça.
Donc, j'en comprends que vous êtes défavorable à la vaccination obligatoire?
On a toujours maintenu la position que pour nous, il faut encourager au maximum la vaccination. On doit faire en sorte que le gouvernement, sa responsabilité, c'est de faire en sorte que les Canadiens soient encouragés à se faire vacciner le plus possible, et c'est comme ça qu'on va s'en sortir.
Hi there, Erica Ibrahim, the Canadian Press. Given how Omicron has demonstrated the fragility of healthcare in Canada, and preserving the system is why provinces imposed new restrictions, do you think it's time the country look at privatizing more parts of it?
There's a lot of policy discussions that are being had right now on the state of healthcare. The reality is that for 2 years we've been dealing with restrictions and lockdowns at this point. Very little has been done in the way of increasing our surge capacity so that our hospital system can be prepared for this. And this is a direct failure on the part of the federal government. Billions of dollars have been spent in areas when in fact there's been very little priority with respect to healthcare. The federal government has put $4 billion towards increasing healthcare capacity. Clearly, that's not enough. This is a failure to plan on the part of the federal government, working with the provinces to ensure that our surge capacity and our healthcare capacity is at a pace right now where we can keep up. And clearly, restrictions and lockdowns are not helping, and they're not helping because of Justin Trudeau's failures to deal with dealing with the healthcare system as well.
So, just to follow up, do you have any sense of your opinion about privatization and whether there's any place for it at this time?
One thing that Canadians hold dear is the universality of their healthcare system. That is something that every Canadian across the country appreciates. I know that there are ongoing discussions right now as to the state of healthcare, why we're not prepared 2 years into this pandemic to deal with the surge that we're seeing as a result of the Omicron virus. Those are legitimate questions, and I think they're policy discussions that need to be had. They need to be had not just at the federal level, but also in partnership with the provinces as well.
Prochaine question dans la salle. Oui, bonjour. Olivier Ferrand-Boissé, TVA. Question pour vous, M. Paulus. Je reviens sur la question de la vaccination obligatoire. Qu'est-ce que vous proposez dans ce cas-là pour augmenter le rythme de vaccination? Parce qu'en ce moment, les hospitalisations, il y a un fort pourcentage que ce sont des personnes non vaccinées. Les provinces qui ont de la difficulté à gérer tout ça. Des nouvelles mesures, des nouvelles aussi restrictions pour les non-vaccinés, mais est-ce que ce sera suffisant? Qu'est-ce qu'on propose pour augmenter le rythme de vaccination, autre qu'encourager simplement?
Bien, déjà, d'encourager, c'est très important. Surtout, premièrement, de cesser d'avoir des discours inflammatoires, d'avoir même le premier ministre le fait dans une entrevue dans le temps des fêtes, là, je veux dire, des accusations sur les personnes non vaccinées, ça mène à rien. Il faut vraiment travailler à expliquer, à mieux expliquer. S'il y en a qui doutent encore, c'est parce qu'ils ont mal compris. Donc, c'est là que le travail doit se faire de façon positive. De notre côté, le Parti conservateur, on a toujours été proactifs. Au début, souvenez-vous, il y a 2 ans, on était les premiers qui remettaient en cause le problème de ne pas avoir de vaccins. Là, on a des vaccins. Après ça, c'est les tests rapides qui ont un problème. On dirait que le gouvernement fédéral fait tout pour qu'on demeure dans une ère de confinement. Et c'est ce qui est le problème, qui crée des problèmes mentaux. Si la population est fatiguée, la population en a plein son casque en bon français. Là, ce qu'on veut, c'est d'en sortir. Maintenant, c'est de convaincre les gens qui n'ont pas encore eu accès au vaccin, c'est de leur expliquer pourquoi c'est important de le faire. Et c'est ça qu'il faut travailler de façon positive. De notre côté, on est très positif envers la vaccination. On veut que les gens soient vaccinés. C'est le meilleur moyen de s'en sortir. On l'a toujours dit et on l'aurait dit. Mais de l'autre côté, le gouvernement Trudeau, ministre de la Santé, M. Duclos, avec le genre de propos qu'ils ont, crée des situations négatives, crée des situations où les provinces se ramassent avec le problème. Les provinces ne savent pas trop comment dealer avec ça. Donc, c'est pas une façon de faire. C'est ce qui est le gros problème actuellement.
Toujours en lien avec la pandémie, concernant les autres outils, ailleurs dans le monde, certains endroits, on va utiliser les traitements antiviraux de Pfizer qui a été autorisé. On a de la demande à Santé Canada depuis le 1er décembre. C'est toujours pas un outil dont on dispose pour la lutte, alors que les hospitalisations pourraient être certaines, en tout cas prévenues à un certain moment par ce traitement-là. Est-ce que vous croyez que c'est le moment d'accélérer le processus maintenant que Dr. Calvert disait sur nos ondes aujourd'hui que c'est peu probable qu'on trouve quelque chose de différent que les autres comme la FDA par exemple. Est-ce que c'est le temps qu'on accélère?
Bien, ça fait partie justement des responsabilités de Jean-Yves Duclos comme ministre de la Santé du Canada, de voir est-ce que l'Organisation de Santé Canada, est-ce que les fonctionnaires, les chercheurs, ceux qui s'occupent de donner les brevets, fassent leur travail de façon plus rapide. C'est son travail, c'est ici que la décision se prend, à Ottawa. Donc, c'est pour ça qu'on demande au gouvernement fédéral de faire son travail et de prendre de l'avance. Parce que depuis le début de la pandémie, on est toujours en retard. On est en retard sur les vaccins, on est en retard sur les tests rapides, on prend des décisions en retard sur la gestion de la frontière. C'est toujours en retard. Les autres pays prennent de l'avance. Pendant ce temps-là, on attend de voir la parade et on réagit. Donc, je demanderai au ministre de la Santé, à Justin Trudeau, de s'occuper, de s'assurer que leurs professionnels de la santé qui travaillent à Santé Canada fassent leur travail rapidement, puis qu'on ait des décisions qui se prennent le plus rapidement possible dans l'intérêt de la santé des Canadiens, qu'on puisse en finir.
We will now take questions on the phone line. Nous prenons des questions au téléphone.
Please press *1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Kevin Gallagher of CTV National News. Please go ahead. Your line is open.
Good morning. My first question I'd like to ask is about the vaccine mandate that Health Minister Jean-Yves Duclos said he felt was something that provinces would consider greatly over the coming months, that there'd be more vaccine mandates coming into effect. Of course, we have one for truckers coming up this weekend. It seems that the Conservative Party certainly opposes vaccine mandates, but I'll follow up on what one of my French colleagues asked, sort of what other measures would the Conservative Party like to see in terms of encouraging vaccinations if vaccine mandates, if the party continues to oppose vaccine mandates?
Well, thank you for your question, Kevin. And, one of the things that we've been consistent on is our belief that vaccines are the safest and most effective way to curb the spread of COVID-19. And we encourage everybody to speak to their medical health professional to get the questions answered about the vaccines. We've also seen, as a result of the failures of the COVID pandemic response, a normalization of lockdowns and restrictions. And Kevin, nobody wants to be in this position. Canadians are tired. They're fed up. They want to make sure that we get back to some sense of normalcy. Vaccines are the most effective tool. I think, the thing that we have to focus on as well is to address the hesitancy that exists. There are many other tools out there that exist, like rapid testing, making sure that, there's accommodations that are going on. I don't think it helps, Kevin, frankly, when the health minister continues to use, and we've seen a pattern of this over the course of the last several months, really started before the election, of incendiary and inflammatory language. That's not going to do anything to encourage people who are hesitant. In fact, I would suggest that it's going to cause them to further push back. So we need to encourage people. And the best information that they can get is through their healthcare professional, talk to their doctors, find out about the vaccines, and make sure that you get vaccinated. We've got to increase our capacity and our vaccination rates, and we're encouraging everybody to do that.
Oh, I have a follow-up. I want to quote from the same National Post article that both you and Pierre Paulus quoted from, but I'll paraphrase a few paragraphs above where you quoted from, Mr. Brassard, that the contractors that PHAC are looking for, they're insisting that they provide anonymized data and that users have the ability to easily opt out of mobility data sharing programs. So in addition to those measures that would ensure that the data being used is not, is anonymized, so you can't tell who the person is, but also that people can opt out of these data sharing projects by PHAC. In addition to those measures, what else would you like to see in terms of protecting privacy and other matters, of course, ethically, if you want to bring up, about this program for using cell phone data to track people's movements during the pandemic?
Well, first of all, Kevin, let me address the situation with PHAC. As I stated at the onset, this was done in secret. No Canadian, the 33 million Canadians who were being followed through their cell phone data, knew that this was happening. So, this is why we've called the meeting of the committee, because you'll have to excuse me and other members of the committee for being cynical as to the direction that PHAC is going on this, because everything was done in secret. In fact, it wasn't until December 17th that this request for proposal was put in place, and conveniently, the closing of the request for proposal closes on January 21st of this month. So the day after Parliament adjourns for the winter setting, and just 10 days before we come back, we've got this RFP that's been issued without any ability for parliamentarians on behalf of Canadians, and now the Parliamentary Committee to have any sort of oversight on this. And so that's what we're asking for today by calling this special committee. We want to know, and there are rightly some questions that need to be asked of PHAC as it relates to privacy, security, the data that's being collected, what it's being used for. I know what PHAC says it's being used for, but that didn't come out until this new RFP was proposed. So we need to get to the bottom of it, and it's incumbent upon parliamentarians to provide this type of oversight so that we don't have significant overreach on the part of government agencies or the government itself using the COVID-19 as an excuse to, go over Canadians' rights to privacy. One of the things that we've also asked for is the Privacy Commissioner to look into this. As I said in my opening statements, it appears that he was unaware that this was happening. Certainly the RFP, he was going to circle back with PHAC to find out more information about this. Shouldn't have been the other way around. Shouldn't the PHAC had gone to the Privacy Commissioner and said, hey, this is what we're thinking about doing. What are some of the things that we need to look out for?
Thank you for listening to Depictions Media Radio.
And welcome back, everybody, to Depictions Media Radio. I am Michael Clogs, your host. And Quebec has been talking about and will probably be taxing unvaccinated people to help pay for the health care or the extended health care hospitalizations that are supposedly being caused by those who are unvaccinated who get COVID-19. So it comes to a question to the Prime Minister about this idea and this policy, and the question is, are they going to do the same thing on a federal level? And the answer that Justin Trudeau presented sounds like we might be looking at something like this happening on a federal level. The only thing that Justin Trudeau really did say out loud was that if you plan on getting on a plane, train, or traveling internationally, that you have to be vaccinated, and if you aren't vaccinated, you will be limited from ever being able to do so. And he repeated that same statement several times when presented with the question of what is going on in Quebec. So by his way of denying the fact that or evading the question of is he supporting Quebec in this, is stating that we might be looking at this on a federal level, that if you are unvaccinated, that you're going to pay extra healthcare costs for being unvaccinated to the healthcare system. How much that tax will be and how far it will go as far as services, if it'll just be because you've contracted COVID-19, or if it will include other services that you might actually need from the healthcare system. That has yet to be seen. But is it fair? Is it fair to charge people more money because they have a different point of view in our society? Is it fair to tax people because they see things a little bit differently, or they subscribe to a different set of experts, equally as educated people as the government is using for experts, but they come to different conclusions? Is that fair to tax people for doing this sort of thing? The other thing that I at this point, Justin Trudeau is Prime Minister. He doesn't need to keep publicly campaigning and looking for votes. He continuously still keeps taking jabs at Aaron O'Toole, when right now we don't need political rhetoric. What we need is leadership, and this constant back and forth between him and Aaron O'Toole isn't serving us as a society. It isn't serving us as the public. And what we really need is for everybody that's sitting on Parliament Hill to just work together and come up with the best solutions that serve everybody. That we find accommodations for the unvaccinated people so that they don't have to lose their jobs, and find ways to help employers keep everybody with a job and a paycheck that needs it and desires it, instead of coming up with different ways to penalize people for not doing what the party wants. So let's listen to the whole press conference with the federal government and what they actually had to say on different issues around vaccines, COVID-19, and what we could be looking coming down the road with, of course, the Omicron variant and the tools that could be new tools that could be introduced to our society to help us fight back against the pandemic.
Bonjour, bienvenue à cette conférence de presse. My name is Guillaume Saint-Pierre from the Journal de Montréal. I'll be your moderator. With us today, Prime Minister Justin Trudeau, Ministre de la Santé Jean-Yves Duclos, Ministre Mary Ng, Trade Minister, Minister Tassi, Procurement. We will start with short remarks from the Prime Minister and Madame Ng, and then we will take questions for about 20 minutes from the Prime Minister, and then 15 minutes for the ministers. Monsieur Trudeau, à vous la parole.
Merci beaucoup. Je suis très content d'être ici avec vous aujourd'hui, accompagné effectivement de la ministre Ng pour une brève allocution et avec les ministres Tassi et Duclos pour répondre à vos questions. On est ici aujourd'hui pour vous parler de ce qu'on fait pour continuer de vous soutenir et de vous protéger pendant ces moments difficiles. On Monday night, we had our 36th First Ministers meeting since the beginning of this pandemic. It was an important and constructive conversation in which we came together to respond to this very difficult Omicron wave that is hitting across the country, particularly in terms of its impact on our healthcare workers and systems. We talked about vaccines, we talked about rapid tests, we talked about procurement of treatments and a number of other issues. We continue to work together across all orders of government to support Canadians, to support our health workers, and to make sure that our economy is able to come roaring back once this wave comes through. On vaccines and boosters, we now, as people know, have enough vaccine supply in this country to make sure that everyone can get fully vaccinated. We continue to bring in doses for any future needs that science and experts will dictate to us. We've advanced 1.8 million doses of Pfizer into January for a total of 6.8 million Pfizer doses in January for Canadians aged 12 and over. So it's really important that everyone get their booster when it's time for you to do so. We have more than 10 million boosters already administered across the country. So if you haven't, please go get your shot. It's never too late to do the right thing. And I can tell you that when you show up to get your very first shot in your local vaccine clinic or your pharmacy, the pharmacists, the healthcare workers will be incredibly pleased to be able to give you your first shot. It is about doing the right thing. They'd much rather be giving you an injection of a vaccine to keep you and everyone safe than having to deal with you in a critical care bed. Please, it's time to get vaccinated. It's time to get your boosters. We notice as well that only about 45% of Canadian kids between 5 and 12 years old have been vaccinated. With schools still virtual, but eventually in many places still virtual and in many places returning soon, we need to make sure that kids are getting vaccinated. Quand je suis parti ce matin pour venir à cette conférence de presse, je suis allé vérifier mes 3 enfants qui étaient chacun dans leur chambre sur ordinateur et iPad en train de faire de l'école virtuelle. On sait que ça va finir bientôt. On veut que tout le monde soit vacciné. S'il vous plaît, encouragez vos amis, vos voisins de se faire vacciner et de faire vacciner leurs enfants. Vaccines work. They work to protect you. They work to protect the vulnerable people around you. They also work to support our frontline healthcare workers who are in danger of being overwhelmed by this Omicron wave. So we're not just supporting them, we're supporting the people who are at risk of seeing important surgeries and treatments canceled because our health systems are getting overrun. We need to continue to do what we know we can do. That is, stay safe, be careful in your gatherings, in your distancing, wear a mask, and yes, remember to continue to get vaccinated. On that, I want to thank once again our extraordinary frontline health workers and everyone working in public health for the incredible work they've done over the past 2 years. This pandemic is dragging on, and it's exhausting for everyone, but it's particularly difficult for those health workers who have been going flat out for the past 2 years to try and keep everyone safe, to try and get us through this. Please do everything we can to protect them. They deserve not just our thanks, our deepest gratitude, but our support. And that means getting the boosters, getting the vaccinations, getting our kids vaccinated so we can get through this. Je veux aussi parler du soutien qu'on continue à offrir à nos entreprises, à nos petites entreprises, à nos travailleurs. La pandémie n'est pas terminée, alors on continue d'être là pour les Canadiens, comme on l'a promis depuis les débuts de cette pandémie. On a du soutien en cas de confinement, on a la subvention salariale. On vous rappelle que la subvention salariale est là pour vous aider à garder vos employés, même si vous êtes en fonction réduite. C'est important de garder ce lien avec les employés. C'est important de pouvoir permettre aux employés de continuer à payer leur loyer, à mettre de la nourriture sur la table pour leur famille, mais aussi de pouvoir revenir le plus rapidement possible une fois que cette vague sera terminée. La reprise économique rapide, on sait que c'est important pour le bien-être économique de tout notre pays. Donc, utilisez cette subvention salariale, elle est là pour vous. Mais les petites entreprises ont aussi besoin de plus de flexibilité. C'est pour ça qu'on va annoncer aujourd'hui, on annonce aujourd'hui qu'on prolonge le délai de remboursement pour les prêts du compte d'urgence pour les entreprises canadiennes. So to support small businesses, we are there with measures like the wage subsidy. I want to remind employers that the wage subsidy is retroactive. So if you're making decisions right now about whether to keep people on through the coming weeks or not, know that that wage subsidy will be there to help you. We want to be able to have people continue to be tied to their jobs so that we can bounce back quicker once this wave is gone and we start reopening. People need the support to be able to keep food on the table. That's why that wage subsidy and the rent subsidy is there, offered by the federal government, to help you make it through this difficult wave. We're also announcing today that we're extending the Canada Emergency Business Account, the CEBA, for eligible borrowers to the end of 2023. Minister Ng will have more details, but the bottom line is, of course, this. We will continue to be there to have people's backs with as much as it takes, with as long as it takes, until we get through this pandemic. I want to end today by speaking directly to kids once again. I know many of you are in virtual school again. Many of you have made more sacrifices over Christmas, over the holidays, not seeing your friends, not seeing your loved ones, having to hunker down, having to help out around the house as your parents are working virtually. This is not easy. And I know almost half of kids across this country have gotten their vaccine from ages 5 to 12. We need to get more. So please ask your parents if you can get vaccinated. Getting vaccinated protects yourself, protects your family, protects your grandparents, protects vulnerable people, but it also supports our frontline workers who are working incredibly hard, our nurses and doctors and people in hospitals who are dealing with a rise in cases. We know kids across this country You've been doing the right things over these past long years, and it sucks, but you've been amazing, and we need to keep doing everything we can to get through this. Je compte sur vous, je compte sur tout le monde à travers le pays de continuer à faire les bonnes affaires, même si on est fatigué, même si on est tanné. On va continuer de faire les bonnes choses pour se protéger, pour assurer que notre pays, notre économie continue à bien fonctionner et qu'on sera toujours capable d'être là les uns pour les autres en faisant les bonnes choses. Je vous remercie de votre attention ce matin. Je suis maintenant très content de céder la parole à la ministre Ng. Mary.
Merci, Premier Ministre. As workers and small businesses and people across the country face renewed uncertainty and with new lockdowns, rising case counts, and the Omicron variant, we continue to know that the best thing for our economy is to support our workers and businesses through this pandemic. I want to thank the millions of Canadians who have stepped up, who have made sacrifices and continue to follow public health measures, including getting their vaccines and their booster shots. And to Canadian small businesses, you have shown incredible resilience throughout this pandemic, and our government will continue to be there for you to support you as we have over the past 2 years. Supports including the Canada Emergency Wage Subsidy and rent subsidies, and now the lockdown program and the Canada Worker Lockdown Benefit. This has helped millions of businesses and workers across the country to get through this pandemic. I also want to take this opportunity to thank the 170 chambers of commerces, the boards of trades, and others across Canada for your help. You've helped to distribute millions of rapid tests from our government to small businesses and workplaces across Canada. Over 15 million tests have been provided to businesses across the country so far, with millions to come. Rapid tests are one of the many tools that we have to fight this pandemic and to support our businesses. Nous avons toujours dit que nous vous conduirons vers le fin de cette pandémie, et nous le ferons. Today, as the Prime Minister has already mentioned, in recognition of the challenges that many of our businesses are facing with these renewed lockdowns, we are extending the repayment deadline for the Canada Emergency Business Account Loans, or otherwise called CEBA, and also for the CEBA equivalent lending that is provided through the Regional Relief and Recovery Fund. We're going to extend to eligible borrowers. They will be able to have until December 31st of 2023 now to repay their loan. We've heard from businesses that they're looking for this flexibility, and that's what today's announcement is about. This additional year will help businesses get that flexibility and continue to work together through this pandemic to the end of this pandemic. I want everyone to know that we're going to continue to have your backs through this pandemic as we drive for a strong and inclusive and a sustainable economic recovery for everyone. Merci beaucoup.
So now we'll go to questions. So we only have 20 minutes. We have, I think, 5 questions in the room, starting with the mic to the left.
Good morning, Prime Minister. Good morning, Ministers. Thank you for taking our questions today. On the proposed issue of this tax or fee for the unvaccinated in Quebec, do you think, Prime Minister, this is the right or legal way to approach this problem? And is this something that you would consider looking at implementing federally?
Obviously, like people across the country, we've received that proposal with interest by the Quebec government, but there's a lot more details that we have to hear on how this would work before I can make any comments on it. But I will remind people that we have been clear at the federal level about how important it is to get vaccinated, and we brought in very strong measures to ensure that travelers across the country need to be fully vaccinated. People coming into the country need to be fully vaccinated. That the federal public service needs to be fully vaccinated. These are things that we have continued to move forward on because the best path forward is vaccination, which is why at the federal level, the fact that there is still a debate being brought forward by the Conservative Party saying that we need to be more accommodating of people who choose not to get vaccinated is, I think, exactly the wrong thing. Mr. O'Toole is out to try and protect his own leadership, and he's not thinking about protecting the healthcare workers who are on the front lines. We know very different jurisdictions are making different decisions about how to encourage people to get vaccinated. And as a federal government, we will be continuing to be there to support them in those decisions and to make sure that everyone gets vaccinated. Évidemment, nous attendons plus de détails sur la proposition du Québec, mais nous êtes certainement là pour continuer à encourager les gens de se faire vacciner. On sait que de passer à travers cette pandémie, ça va exiger que le plus grand nombre de gens possible se fassent vacciner. C'est pour ça qu'on a pris des mesures pour exiger la vaccination obligatoire pour ceux qui veulent voyager dans ce pays, pour les travailleurs de la fonction publique. Et nous allons continuer d'être là pour appuyer les provinces qui prennent des mesures supplémentaires.
Just following up on your comments about Mr. O'Toole, he says that you're incentivizing and normalizing lockdowns, and by demonizing the unvaccinated, you're pushing them further away from getting the shot. I'm wondering if you can comment a bit more on these allegations, and also whether or not you think that the government and you personally need to take another approach here when it comes to those who clearly, at this point in the pandemic, are not getting the shot.
We've continued to work in many, many different ways to encourage people to get vaccinated, whether it's public information campaigns, whether it's local and peer leadership to encourage people in different languages, in their communities, to get vaccinated. We've continued to put forward strong incentives to be vaccinated. If you want to get on a plane, if you want to get on a train, if you want to travel internationally, these are the kinds of things that encourage people to get vaccinated. And I can tell you that there continue to be people showing up in vaccination clinics to get their first shots, including this week. This is something we will continue to encourage. Quite frankly, on the conservative side, trying to pretend that rapid testing or testing in general is as good as getting vaccinated is simply irresponsible. Mr. O'Toole is more focused on appeasing the anti-vaxxers within his own caucus than he is on protecting Canadians, and certainly than on supporting frontline workers. If Mr. O'Toole was serious about being a leader to get Canadians through this pandemic, he would start by making sure that all of his MPs get vaccinated.
Abigail Beeman, Global News. Prime Minister, I hear you say that you're waiting for more details from Quebec before weighing in, but you've also highlighted the steps that you have taken federally in terms of unvaccinated people not being allowed to get on a plane or a train. So I'm wondering, how far are you willing to go at the federal level, and are you considering any mechanism of making an unvaccinated person pay for more health care or via tax, just the idea of it?
We've moved forward on some very strong incentives. If someone wants to get on a plane or get on a train, they now have to be vaccinated. There's no way around that. If you want to work for the federal public service, you need to be vaccinated. These are areas that are in control of the federal government, and these are measures that are strong that we've brought in, that the Conservative Party, for example, continues to disagree with, but we know that the vast majority of Canadians stand with. I continue to work with health experts to look at how we can encourage more and more people to get vaccinated, to get their boosters, to continue to get their kids vaccinated. But I will highlight that Canada is doing better than most countries around the world in terms of rates of vaccination. Canadians have continued to step up and do the right things, and it is something that I think we can all take pride in, the fact that Canadians have shown so unequivocally, for the most part, that we are there for each other. But I'm happy to turn it over to the Minister of Health, who is, of course, looking at more ways of encouraging Canadians to get vaccinated.
Yes, I agree entirely with what the Prime Minister said. First, we are waiting for details on the measure announced yesterday by the government of Quebec. Second, I exchanged with my colleagues over the last few weeks and just recently with the Quebec minister, and we are all on board when it comes to supporting universality of access to health care across Canada. This being said, we need to remind everyone, as the Prime Minister just said, that vaccination is the way out of this wave and out of the crisis in general. It works. You know, science has been telling us
Thank you for listening to Depictions Media Radio.
Welcome back to Depictions Media Radio. I'm your host, Michael Clogs, and the next segment is going to be an update from the Public Health Officer, Dr. Teresa Tam. And she's the Public Health Officer, of course, for Canada. And today's update is a longer-range forecast that suggests that continued large surge of rapidly accelerating Omicron cases in forecasted for Canada. Importantly, the latest forecast showed that even with lower risk of hospitalizations for Omicron compared to Delta, the number of new daily admissions could still exceed previous historic peaks due to the sheer volume of cases that could occur. The thing is the Omicron variant is said to be more transmissible and more contagious than the other variants. It also has a short incubation period, which, if causing severe illness in people, could potentially put a strain on healthcare systems. So it is important that we still observe all the public health measures, and that we do what we can to stay away from each other and do the distancing and washing of hands, all those sort of things that we have been doing in the past to protect each other from COVID-19. So with that, let's listen to what Dr. Tam and Dr. Nguyen actually have to say with today's latest update from the Canadian Public Health Office.
Virtuel, with us today, Dr. Teresa Tam, Chief Medical Officer, and Dr. Howard New, administrateur en chef adjoint de la santé publique, qui vont présenter les plus récentes courbes. Alors, on va commencer avec des commentaires des médecins et ensuite on prendra des questions au téléphone. Dr. Tam, the floor is yours.
Merci beaucoup. Thank you. And hello, everyone. Bonjour à tous. Today, we'll provide the latest update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Coming out of the holiday season, we're seeing how quickly Omicron has changed the landscape of the epidemic in Canada. In just a few short weeks, Omicron has spread faster and further than any previous variant. At the same time, we're seeing Canadians rise and adapt to the latest challenges by updating their vaccine protection, improving their mask quality and fit, and keeping up with multiple other layers of protection to reduce their risk of exposure and spreading the virus. Public health has also had to adapt in the face of the explosive spread of Omicron cases that has exceeded the testing capacity in many areas of the country. Although some of our earlier indicators, like daily case counts, are now strikingly high, while at the same time significantly underestimating the true number of new infections. This update puts more emphasis on some of the many other indicators that continue to be useful for monitoring current trends and predicting longer-range trajectories.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur les travaux d'épidémiologie et de modélisation effectués au pays qui orientent la gestion continue de la COVID-19 au Canada. À la suite de la période des fêtes, on constate la vitesse à laquelle le variant Omicron a transformé le contexte de la pandémie au Canada. En à peine quelques semaines, Omicron s'est propagé plus vite et plus largement que tout autre variant antérieur. Au même moment, on voit les Canadiens réagir et s'adapter aux plus récents défis en mettant en jour leur protection vaccinale, en améliorant la qualité à l'ajustement des masques qu'ils portent et en maintenant d'autres couches de protection destinées à réduire le risque d'exposition au virus et de propagation de celui-ci. La santé publique, elle aussi, a dû s'adapter face à la propagation fulgurante des cas d'Omicron, qui a débordé la capacité de dépistage dans de nombreuses régions du pays. Bien que certains des premiers indicateurs, tels que le nombre quotidien des cas, soient actuellement extrêmement élevés et que le nombre réel de nouvelles infections soit considérablement sous-estimé, la présente séance est plutôt axée sur d'autres indicateurs qui demeurent utiles à la surveillance des tendances et à la prévision des trajectoires à long terme.
Slide 1. Since the last epidemiology and modeling update in December, despite being underestimated, current national case counts of over 37,500 new cases reported daily are far exceeding all previous peaks of the pandemic. The sudden spike in Omicron infections has daily case counts now trending far above the daily counts for severe outcomes. And while international surveillance shows that severity trends do not rise at the same explosive rate as cases, the record high volume of cases associated with the Omicron surge is nevertheless expected to heavily impact hospitals. Although there are likely to be continued challenges before we hope to see improvement, caution and perseverance will help to get us through this difficult period sooner and mitigate the impacts on our severely strained health system.
Diapositive 2. Avec des taux d'infection très élevés qui défient ou dépassent les capacités de dépistage dans une grande partie du pays, un éventail d'autres indicateurs tels que la positivité des tests de laboratoire sont utiles pour surveiller l'activité de la maladie au niveau de la population. Actuellement, le pourcentage de positivité des tests de laboratoire est de 28%, signifiant que le virus est détecté dans plus d'un test sur 4. Bien que de nombreuses juridictions accordent la priorité de dépistage aux personnes et aux populations les plus à risque de maladies graves ou d'exposition, le taux de positivité très élevé actuel montre que la COVID-19 s'est largement propagée et que le nombre de cas sous-estime le véritable fardeau de l'infection dans la population en général. Néanmoins, le suivi de la tendance en ce qui concerne cet indicateur peut nous aider à déterminer si la COVID-19 demeure très répandue ou si elle commence à s'affaiblir dans certaines régions du pays. En même temps, d'autres indicateurs continuent d'être utilisés en parallèle pour surveiller d'autres aspects, notamment les tendances en matière de gravité de la maladie.
Slide 3. That Omicron is the most contagious variant observed to date is evident from these curves, showing the sudden increase in the proportion of cases due to Omicron shown by the red curve on the right. First reported in Canada in late November, Omicron has rapidly replaced Delta to become the predominant variant circulating in Canada as of mid-December.
Diapositive 4. Les tendances liées aux hospitalisations sont indiquées pour les 6 provinces canadiennes les plus populeuses, mais contrairement aux vagues précédentes de la pandémie, pendant lesquelles la propagation de la maladie était généralement bien maîtrisée dans certaines juridictions plus petites, la hausse des cas attribuables au variant Omicron est généralisée au pays. Bien que les données indiquent que le risque d'hospitalisation est plus faible pour le variant Omicron que pour le Delta, des cas de maladies graves surviennent toujours avec Omicron et les répercussions sur le système de santé et d'autres secteurs peuvent être substantielles. Ceci s'explique par la hausse des hospitalisations et des admissions aux soins intensifs, ainsi que par l'augmentation du nombre d'employés malades et devant s'isoler. Déjà, le nombre énorme de cas a commencé à stimuler une augmentation des tendances de cas de maladies graves à l'échelle nationale. Ces augmentations sont plus évidentes en Ontario et au Québec, qui ont été les premiers à connaître la poussée d'Omicron, mais la plupart des régions du pays commencent à voir ou devraient s'attendre à voir de fortes augmentations de nombre quotidien d'hospitalisation au cours des prochaines semaines. Depuis notre dernière mise à jour, le nombre de personnes atteintes de la COVID-19 traitées dans nos hôpitaux a plus que quadruplé pour atteindre une moyenne de plus de 6 779 hospitalisations par jour, tandis que le nombre de personnes se trouvant aux soins intensifs a doublé pour atteindre une moyenne de plus de 884 par jour et 82 décès ont été signalés quotidiennement. Maintenir les taux d'infection à de faibles niveaux reste essentiel afin d'atténuer l'augmentation des tendances de maladies graves autant que possible au cours des prochaines semaines.
Slide 5. The incidence of reported cases is higher across all age groups than at any time previously during the pandemic, as opposed to previous weeks when rates were highest among 5 to 11-year-olds who were just becoming eligible for vaccination. Incidence rates are currently highest among adults aged 20 to 39 years. With Omicron's greater ability to evade prior immunity from infection and vaccines, cases are now increasing in all age groups.
Diapositive 6. Bien que le nombre global de cas entraîne une hausse des taux d'hospitalisation dans tous les groupes d'âge, la répartition par âge des cas hospitalisés est similaire aux vagues précédentes de la pandémie, avec les taux d'hospitalisation les plus élevés étant observés chez les Canadiens plus âgés. Au cours des derniers mois, les cas de maladies graves, y compris le nombre d'hospitalisations et d'admissions aux soins intensifs, ont été les plus importants chez les adultes de 60 ans et plus, et particulièrement chez eux de 80 ans et plus. En fin de compte, l'impact à l'échelle de la population dépendra du nombre global de cas entraînant une maladie grave. Donc, tout ce que nous pouvons faire pour ralentir la propagation contribue à atténuer l'impact individuel et collectif. Chez les groupes d'âge plus jeunes, les cas parmi les nourrissons âgés de moins d'1 an sont presque 7 fois plus susceptibles d'être hospitalisés que les enfants âgés d'1 à 4 ans. Mais, bien que le nombre d'hospitalisations ait augmenté chez les enfants comparativement aux vagues précédentes, il demeure faible dans l'ensemble, représentant moins de 1% des cas signalés chez les enfants de moins de 5 ans. Heureusement, chez les enfants, les taux d'admission en soins intensifs continuent d'être faibles. Néanmoins, en maintenant les taux d'infection les plus bas que possible, nous pouvons réduire le nombre de maladies graves chez les enfants.
Slide 7. Omicron's rapid rate of spread is likely due to a combination of inherent characteristics of the virus that makes it more transmissible and increased ability to evade prior immunity from past infection and vaccination. Similarly, Omicron's lower severity profile, as seen in international and Canadian data, is likely due to characteristics of the virus and protection from severe disease as a result of vaccination and or prior infection. This is supported by the fact that those with 2 doses of vaccine are less likely to be admitted to hospital, and this protection is increased with an additional mRNA vaccine dose of either Moderna or Pfizer COVID-19 vaccines. While considerably lower proportion of Omicron cases are being hospitalized compared to Delta, severe illness does occur with Omicron, and the impact on the health system and other sectors is expected to be substantial. Hence, vaccination, including getting an mRNA booster dose as eligible, continues to be important in combination with timed and targeted public health measures and individual protective practices for slowing COVID-19 infection rates and help to reduce impact on healthcare capacity. As well, despite a high number of outbreaks being reported in long-term care homes and seniors' residences, preliminary evidence indicates that these outbreaks are associated with less severe illness and the number of deaths remains low. However, as seen with hospital outbreaks, these outbreaks can involve a high number of cases among staff, which is contributing to reduced staffing levels.
Diapositive 8. En tout, plus que 72 millions de doses de vaccins contre le COVID-19 ont été administrées au Canada depuis le début de la vaccination à la mi-décembre 2020. Cependant, bien que les Canadiens âgés de 12 ans et plus ont eu une couverture vaccinale de plus de 83% ayant reçu au moins 2 doses de vaccin, la couverture est beaucoup plus faible chez les enfants âgés de 5 à 11 ans qui sont récemment devenus éligibles à la vaccination. 48% d'entre eux ayant reçu une dose. Au total, il y a plus de 6,5 millions de Canadiens présentement admissibles à la vaccination qui ne sont pas encore vaccinés ou qui ont reçu moins de 2 doses de vaccin contre la COVID-19.
Slide 9. In terms of additional doses, 11 million COVID-19 vaccines third doses have been given, the majority of which are booster doses. While we are making progress in updating protection for those in higher risk groups, including older adults, we need to continue efforts to increase vaccine coverage to enhance protection for everyone we can. As seen in this chart, a considerable proportion of Canadians who have received at least 2 doses still need an additional dose to restore protection that may have waned since completing their primary series.
Diapositive 10. Le fait d'être entièrement vacciné ayant reçu au moins 2 doses de vaccin continue d'offrir une bonne protection contre les maladies graves nécessitant l'hospitalisation. Dans ce graphique, la forme de la courbe de ces cas hospitalisés chez les personnes non vaccinées concorde étroitement avec l'incidence globale des hospitalisations pendant la montée à la chute de la vague entraînée par Delta et vers la hausse d'Omicron. À l'inverse, le taux d'hospitalisation des Canadiens vaccinés est resté à un faible niveau tout au long de la vague Delta et commence tout juste à augmenter avec le début de la vague Omicron. Il est important de noter que selon les données d'hôpitaux sélectionnés jusqu'à la fin décembre, la majorité des adultes hospitalisés avec la COVID-19 étaient des personnes atteintes d'une maladie grave liée à la COVID, tandis que jusqu'à un tiers ou plus avec la COVID-19 étaient admis pour d'autres raisons. Néanmoins, ces tendances montrent clairement que le fait d'être vacciné avec 2 doses ou plus offre une protection élevée. Du début novembre au début décembre, lorsque Delta était toujours le variant prédominant au Canada, les personnes non vaccinées étaient 19 fois plus susceptibles d'être hospitalisées. Alors que l'administration des doses de rappel se poursuit, être à jour avec nos vaccins contre la COVID-19 devrait préserver cet avantage de protection.
Slide 11. This updated longer-range forecast shows how the Omicron wave could evolve in the coming weeks as cases continue to accelerate across the country. It is important to note that this trajectory estimates the true number of daily cases, as opposed to reported cases, that may be occurring in Canada each day. Due to constraints on testing capacity, these numbers are much higher than can be detected. It far exceeds the number of cases reported in the surveillance data, shown here as orange dots. The 2 scenarios shown on the slide, both of which incorporate the impact of booster doses, suggest that the Omicron variant could cause a large wave that may peak in January and then recede into February. However, it's important to remember that these are modeled scenarios and the timing of the peak is likely to vary across the country. The red line trajectory shows that without recent strengthening of public health measures in many jurisdictions, the Omicron wave could have peaked at about 300,000 actual daily cases. Whereas the blue line trajectory shows that with the recent implementation of stronger measures, we could experience a peak that is lower, with about 170,000 actual daily cases. These scenarios highlight that while combined public health measures and booster doses could help reduce the size of the Omicron wave, in either scenario, the true number of daily cases driven by extremely high transmissibility of the Omicron variant could still vastly exceed anything we have experienced to date during this pandemic.
Diapositive 12. Cette nouvelle prévision modélisée portant sur les nouvelles hospitalisations quotidiennes prévues nous aide à comprendre comment la hausse exponentielle des cas pourrait affecter notre système de santé au cours des prochaines semaines. en supposant que le nombre de cas d'Omicron suivra la trajectoire de la ligne inférieure de la diapositive précédente, compte tenu de la mise en œuvre récente des mesures de santé publique dans de nombreux endroits du pays. Cette prévision montre les deux trajectoires possibles concernant les nouvelles hospitalisations quotidiennes. La trajectoire de la ligne jaune foncé supérieure montre l'impact potentiel sur les hospitalisations si le taux d'hospitalisation pour Omicron était aussi élevé que Delta. La trajectoire de la ligne bleue inférieure montre l'impact potentiel si le taux d'hospitalisation était de 40% celui de Delta, conformément aux preuves émergentes d'une réduction de la gravité de la maladie au Canada et à l'étranger. Ces scénarios portent à croire que même si nous suivons la prévision plus faible concernant le nombre de cas et le taux d'hospitalisation nettement inférieur du variant Omicron, les nouvelles hospitalisations quotidiennes pourraient tout de même dépasser les pics historiques représentés par la ligne tirée horizontale verte en raison du grand nombre de cas qui pourraient survenir. Il est important de souligner que cette prévision ne reflète que les nouvelles admissions quotidiennes à l'hôpital pour la COVID-19 et non le nombre total de personnes hospitalisées avec une maladie liée à la COVID-19 lors d'une journée donnée. Mais quoi qu'il en soit, nous nous attendons à ce que le nombre d'hospitalisations quotidiennes constitue un lourd fardeau pour le système de santé au cours des prochaines semaines.
Slide 13, experiences of other countries that also experience an Omicron surge provide additional insights into how the pandemic may evolve in the weeks to come. Countries like the United Kingdom and United States that experience a sudden and very steep rise in Omicron cases also experience a sharp rise in hospitalizations. However, given the lower severity profile of Omicron, hospitalizations haven't increased at the same explosive rate as cases. Nevertheless, the sudden acceleration and enormous volume of cases associated with an Omicron surge puts an intense strain on hospitals over several weeks and adds to longer-lasting impacts, such as extended backlogs and strained workforce. With early signs that the surge in cases and hospitalizations may have peaked in parts of the US and UK, it is hoped that the heaviest impacts will soon be over in these countries. Likewise, if Canada's trajectory continues to follow a similar path, we are hopeful that cases will soon peak.
Diapositive 14. Alors que le Canada pourrait atteindre un pic prononcé suivi d'un déclin du nombre de cas dans les semaines à venir, étant donné que l'activité de la maladie dépasse de loin les pics précédents, même la descente de cette courbe sera considérable. Avec plusieurs semaines d'activité très intense attendues, nous devons faire de notre mieux dès maintenant pour limiter l'ampleur de la flambée d'Omicron afin de préserver les systèmes de santé et les fonctions critiques de la société. En pratique, nous devons continuer à, premièrement, être à jour avec nos vaccins contre la COVID-19, y compris recevoir une dose de rappel lorsqu'on est éligible. Les vaccins ARNM, Pfizer-BioNTech ou Moderna sont efficaces comme dose de rappel, alors ayez confiance en acceptant le vaccin qui vous est proposé. Deuxièmement, limitez les contacts personnels aux membres immédiats d'une même résidence dans la mesure du possible et finalement, utilisez systématiquement des couches de protection personnelle pour réduire les risques d'exposition et de propagation du virus. En suivant les conseils locaux de santé publique, portant un masque facial de bonne qualité et bien ajusté et maintenir une bonne ventilation. Merci. Thank you, Miigwech.
So I'm just going to repeat the last slide, slide 14. So while Canada could see a sharp peak and decline in cases in the coming weeks, given disease activity far exceeds previous peaks, even the downside of this curve could be considerable. With several weeks of very intense activity expected to come, we need to do our best now to limit the size of the Omicron surge in order to maintain the health system and critical functions of society. Practically speaking, we need to continue to, 1, Get up to date with COVID-19 vaccines, including getting a booster dose when eligible. Either the Pfizer-BioNTech or Moderna mRNA vaccines are effective as boosters, so please feel confident in accepting whichever vaccine is offered to you. Secondly, limiting
Thank you for listening to Depictions Media Radio. And welcome back, everybody, to Depictions Media Radio. I am your host, Michael Clogs. Is our government really doing everything it can to protect us from COVID-19 and all the variants, especially when we consider the Omicron variant? The WHO has issued a long list of advisories that should be put into our public health measures, and we need to know that these things are being taken seriously. We need to know that the study and the science is actually being taken seriously. We need to see that the government is sharing all of its data, all of its outcomes with us, not just what it wants us to hear. There are tools that are out there that haven't been shared within the country of Canada. They say that, that it's still being looked at, or that we still haven't had a chance to work on the approval for things, whereas in other countries, the tools such as the antiviral pill have been released and are actually in hospitals and saving people's lives, whether they're vaccinated or not. Yes, the vaccine is a very important tool, but it is only one tool out of an entire toolbox. It would seem that tools are being ignored. Are they being ignored because we don't believe in that the health ministry here doesn't believe that they work, or are they being ignored because they're not profitable? Because there's a bigger, shall we say, paycheck to the vaccination versus the Merck antiviral pill. Is Pfizer giving them a better deal than what Merck would? Is there a point where economy and money need to take a sidestep to the betterment of our public health? Is public health actually being looked after, or is our government too worried about looking at the corporate bottom lines and who is going to actually be donating to the next campaign fund? We've heard from Aaron O'Toole asking about why some of these tools haven't been looked at as yet. We've heard from other politicians about different things dealing with public health and traceability of people who may or may not have been infected or may or may not have been vaccinated. And there are a lot of questions out there, but what we need is some of those questions to start to be answered. There's one thing that we can take some of this into our own hands, and we listen to what the public health measures are, and we go back to other documentation that has been released from global health sources. And of course, we have here at Depictions Media, depictions.media, that we have some of those documentations listed on our website where you can actually go and download them, read them for yourself, see what global health sources are saying, and then match them back to what local health sources are actually saying. So you can decide for yourself what is actually happening and what is best for you and your family. So let's move on with today's segment with Dr. Bonnie Henry and Adrian Dix giving our next update in British Columbia for COVID-19 and measures to help curb the transmission of the Omicron variant.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Tuesday, January the 11th. We're honored to be here in Victoria today on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations, honored to be here on their lands. Our next briefing will be Friday of this week, and Dr. Henry and I will be in different locations for that briefing, but we'll be going through some of the issues around modeling on that day. So that will be what you can expect on Friday morning. So with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today I want to talk a little bit about what's happening right now. No surprise to people, we continue to see high rates of virus transmission across British Columbia, and this is anticipated to continue for the next few weeks. I think we're getting the sense that we have leveled off somewhat, and if we look at what we're seeing in other jurisdictions that have been ahead of us in terms of this wave around Canada and around the world, we may be entering soon into the place where we will see a decline. But right now, our primary focus needs to be on keeping as much as possible open in our communities and ensuring that we have that balance, that our healthcare system is not getting overwhelmed, as stretched as it is. As we know, hospitalizations are going up, and hospitalizations come after our infections start to rise. It's a lagging indicator. Many of the people in hospital have a Delta variant. Some of them have been there for some time, but we still don't know the full effect that Omicron and the rates of hospitalization that we're seeing now are going to have on our healthcare system and the level of care that's going to be required in the coming weeks. Later this month as well, we anticipate that we'll have additional treatment options that will be available in BC, and we're preparing for that as well. As we've talked about before, there's a number of new antiviral medications, particularly Paxlovid, also molnupiravir, that are under review by Health Canada, and we're hopeful that those will be available, another important tool to help us keep people out of hospital who are at risk of having severe illness with COVID-19. What this means in the short term is that the restrictions on gatherings and events are likely to remain unchanged for now. And in parallel, we are looking at what we can safely resume now that all businesses have COVID safety plans, starting to put those back in place again too. And later this week, we'll be providing an update on the modeling data and on more detailed information about who is at risk in hospitals. What we're also seeing right now is a changing risk scenario, where the risks for those who are vaccinated is very different, even with this strain of Omicron, from those who are unvaccinated. And I've talked, since we've discovered this new variant, Omicron, about putting together the pictures of the puzzle, the pieces of the puzzle, to get a full picture of how it's affecting us. And one of the things that is becoming very, very clear is that this strain of the virus is absolutely mostly mild in people who have the protection that vaccination offers. But if you are unvaccinated, you don't have that protection, and your personal risk has gone up dramatically in some communities. You are also at higher risk, if not having that priming of your immune system, at higher risk having severe illness and ending up in hospital. And we're seeing that here in BC. We're seeing that in countries around the world. The majority of hospitalizations, and in particular the majority of people who are in our ICUs needing critical care right now, continue to be people who don't have that protection that vaccination gives by priming our immune system. And the way the virus is spreading right now, people who don't have that additional protection don't also have the same protection from reduced transmission through community immunity, that halo protection from everybody else being vaccinated. And this is one of the challenges that we're facing right now with Omicron, because people who are vaccinated do have good protection, good strong protection against hospitalization and severe illness, but we are getting infected at a much higher rate. And we see that in the numbers that we see every day, where the numbers of cases, the percent who are positive, reflect the percent of vaccinated people in the community. So if you are vaccinated, we now know with Omicron, yes, you do have a potential to contract the virus. This decreases with the booster dose, so that's good news, by about 50%. So it doesn't take it down to zero like it did with a number of the other variants that we see, but it does reduce it. But the risk has increased with this new Omicron variant, and the likelihood of severe illness, though, and hospitalization remains very, very low. So the new data that we've seen, and we were talking about this in my federal group this morning, about 60 to 70% less likely to need hospital care for people who have 2 doses of vaccine. You're 60 to 70% less likely to need hospital care up to 6 months after you've received your dose 2. So that's great. That really is important right now with this variant, even though it's probably milder in overall. That protection against hospitalization is critical with the very high numbers of transmissions we're seeing right now. And that protection from hospitalization, severe illness, and death increases once again back up to the high 80s to 90% after that third or booster dose. So yes, vaccinated people are becoming infected, and the percent of vaccinated cases reflects that. But they're much, much less likely to need hospital care, ICU care, or to die from COVID. And the number of people in hospital, and we see that in our issues bulletin that we put out every day, that number of people is increasing in the vaccinated. But we have to remember that's because the vast majority of people in BC are vaccinated. So the risk, though, is much, much lower once you're vaccinated. So as of yesterday, for example, the age-adjusted risk if you were unvaccinated was about 35 per 100,000 people. And those who are vaccinated, it dropped down dramatically to 4 per 100,000. So those are the things that we need to look at now to see what we're, to understand risk on a personal level and on a community level. We're also seeing data from Denmark in particular, some really good studies, but also the UK, that shows that vaccinated people are less likely to transmit Omicron to their household contacts, the people they're closest to. And we see that people with even 2 doses of vaccine are less likely to transmit, and if you have that booster dose, that goes down even further. That's really important. So the sum of it really is, if you are vaccinated, you have less risk of infection, particularly after your booster. You're much more likely to have mild illness, to not need hospital care, to not need ICU care, and to not die from this virus. And the risk that you're going to pass it on to others is dramatically reduced compared to people who don't have that protection. Last week, I spoke about the requirements for businesses to reactivate those COVID safety plans that helped us get through these last few waves of COVID. And I want to thank WorkSafe and the industry partners that we've been meeting with over the past week. For this is an important tool. It is modified. It's modified to deal with the situation that we're in right now and to recognize the importance of the workforce being vaccinated as a way to protect our businesses and keep them them open and keep them going, but also to look at things that are no longer needed in this context that we're in now. So rather than having capacity limits, for example, looking at where in a business or an organization or a retail outlet you see choke points, for example, and being able to develop a plan that makes sure that we alleviate those rather than relying on the blunt measure of things like capacity limits. So these are important tools, but today I also want to speak about, in the context, the risk context that I just talked about, the importance of each of us also thinking about our own personal COVID safety plans to get through this wave of Omicron. It's about doing our own personal risk assessment, determining what is safer for us right now and what should be paused for this period of time when we know there's a lot of transmission happening around us, so that we can continue to do those critical things like going to work and ensuring our children can continue to go to school. So first, we need to consider things like age. We know that even with booster doses, we're at higher risk the older we are, and we saw that in breakthrough cases in people who are over 70 and over 80 and over 90, and still right now we have people in critical care in their 70s, 80s, and 90s who don't have the protection of vaccines. It is incredibly important. It's a small number of people, but I think I can appeal to you now more than ever. It's very important that you get that protection. If you spend a lot of time with those who are older or with family members who are immune compromised or going through treatments like cancer treatments, you need to take additional precautions in other aspects of your life. Think about your own health profile. If you also have an underlying health condition or clinically extremely vulnerable, we still need to have those protections right now as we get through this wave. It's also important for us to think about our children in school. If we work in a place where we have contacts with lots of people in the public that we don't know, these are all things that we need to consider in making our own adjustments. Many of the things people are already likely doing, and I know that from my own contacts and friends and family. But some, like business plans, may have to be brushed off again. And as much as we are frustrated and want it to be back to the easy way it was before this pandemic, we are going to get through this wave, and we need to rely on those tools that helped us get here. Transition to having things like your social connections, those important social connections, outside if you can, or virtual. We know that virtual connections are not anyway a replacement for being with people in person, but they are incredibly important right now, especially if we're feeling discouraged and down. And we know that there's other people out there who may be having to cocoon and because of their own risk. Reach out to a friend, reach out to a family member, whether you do that virtually or whether you do that outside. Keeping our social circle smaller if we're in those higher risk groups to 1 or 2 families. I think about some of my friends, and you know, if you play old-timers hockey, play on 1 team, not 3 teams this season. And for kids doing extracurricular activities, we need to really make sure that we're prioritizing the essential aspects of school and perhaps limiting activities outside of school. So maybe 1 key activity rather than 3 or 4. And if you are unvaccinated, you really do need to consider your risk right now and take measures to reduce your risk of contracting this virus, because it can have dramatic effects on you. Right now, we have 3 people in ICU in this province who are unvaccinated people in their 20s, and we have 1 person in their 30s in critical care in an ICU with COVID. And you know, that is a preventable illness. It creates a lot of distress for our healthcare workers to be caring for young people and seeing them in so much distress when it can be prevented. So again, I want to encourage people. This wave is moving quickly, and it means you need to do everything to protect yourself right now. And we know that this wave will move through quickly as well. This week, our K-12 school communities had a full return with enhanced protocols and lots of challenges in place right now. And I know from the young people in my life that it was a really positive experience for children, despite all of our fears and anxieties, and there are absolutely a lot of anxieties right now that we all have. But we recognize that, these are the best places for children to be, and it's so important for them to have those social interactions and the intellectual and physical and mental stimulation that schools give. But it is challenging times, and it will be bumpy over the next few weeks as we get through this wave. But I just want to express my gratitude to the school staff and school communities, because I know as we all work together on this and we communicate and we talk about how things are going and we make those plans, and I know that many classes, the teachers and the school staff are working with students, so they have plans in place if they have to close for a few days. But all of us are committed to making sure we can give children the best stable environment over the next few weeks that we can, and that will remain flexible and adaptable as we have through this. And I know it won't be perfect, but we will get through this, and we know how important it is, and it's making sure that we do everything we can to keep children in school as much as possible. I know for many people with these high rates of transmission, it can be very discouraging, and we can feel powerless despite our best efforts, despite the fact that we've done everything right. But we feel that we're powerless to keep our loved ones and ourselves safe sometimes. Others, and I can appreciate this as well, are likely feeling exhausted by this need for continued vigilance, to wearing masks, to watching where I'm going, to everything seems somewhat more difficult right now. We're all feeling like we're getting battered by wave after wave of this storm. But let's not forget, there is much that we do have control over, and there's a lot that we can do safely and happily. Today, we know much more about the virus than we knew 2 years ago or even 1 year ago, and we know now more about Omicron than we did even a week or 2 weeks ago. We know the steps we need to take to have those important social connections in a safe way, and it's different for each of us, and it's different with the people that we're having those connections with. We know that we can see family and friends, even though it might mean seeing them outside, or keeping our circles smaller, or seeing fewer people, so those who are at higher risk can remain safe. We also know that vaccines are providing a high level of protection. They're keeping people out of hospital, and they're preventing the transmission to those we're closest to. So even though you are fully vaccinated and may still get infected with Omicron, because that's what the virus does, the potential for you missing work or social connections or requiring care in hospital is just that much lower. I have spoken before about the importance of keeping our wall strong, and to do that we absolutely need to use all our layers of protection, but we also need to think about our mental, emotional, and physical well-being. And I encourage everyone to find the optimism and hope that does exist in all of us, and share that with those around you. Celebrate your child's school success and the happiness that they have being around their friends and their teachers in the school community. We all know the joy that comes from giving back. So take a day to volunteer in your community, to reach out, as we've done so many times over these past 2 years, to your neighbor who may need some help getting groceries in this weather, or may need some help with shoveling their driveway. We all need to be physically active, and going for a walk with a friend is a great way to do that, or finding ways to connect online and do a circuit class, as I do. These may be different approaches than what we've done before or what we want to do right now, but that's okay. We have proven our adaptability and our resilience, and we'll get through this wave too. We will get through this storm and this surge with kindness and by being calm and staying safe. Thank you.
Thank you very much, Dr. Henry. And today I'll be providing an update on surgical postponements, rapid tests, healthcare workers away due to sickness, and BC's booster rollout. I would say our really exceptional vaccination campaign will be reaching by the end of this week 10 million doses administered across the province, COVID-19 vaccine doses since the beginning of our vaccination campaign, which is simply an exceptional achievement by our healthcare workers and by our volunteers, by people in BC. 4,426,451 first doses, 4,146,540 second doses, and as of today, last night, 1,239,995 third doses. With respect to the booster campaign, we have sent over 2 million booster or third dose invites since October 27th. Approximately 52.6% of the eligible population, which remember is those who've received their.
Thank you for listening to Depictions Media Radio. Welcome back to Depictions Media Radio. I am your host, Michael Clogs, and in the next segment, you're going to hear from Rafi Khanna about a new business grant and support for all those businesses that have been shut down by public health orders issued by Adrian Dix and Dr. Bonnie Henry. This will include bars, gyms, nightclubs, things like that. But operating a business in British Columbia hasn't really been easy. When British Columbia has been hit by floods, fires, and other sorts of disasters outside of the pandemic, supply chains have been slowed down, trucking routes at times put to a halt because the roads are just simply impassable because of mudslides and rocks landing onto the roads, even roads being simply just washed out because of high waters and flood activities. Even right now, British Columbia has received an unseasonable amount of water with snow and then hit with a warming spell and heavy rain followed after that. So business supports are really needed from the government. Supports in the communities are really needed, even though this particular one is centralized solely around the Omicron variant and COVID-19 lockdowns to those specific businesses of gyms, nightclubs, and bars. Other business supports we're hoping will be on the way from the provincial government. So let's listen to what Rafi actually has to say and who can apply for these next rounds of supports.
Good morning. I'm Ravi Kahlon, BC's Minister for Jobs, Economic Recovery and Innovation. I'd like to begin by acknowledging that I'm speaking to you today from the traditional territory of the Coast Salish people, in particular the Musqueam, Squamish, and the Tsleil-Waututh nations. The continuing surge of Omicron COVID-19 cases has created new challenges for us all. I know that this is not the way we wanted to start the new year. Over the last few weeks, I've been talking to business owners and workers directly impacted by the latest public health orders. I know that many businesses are doing the right thing. They're doing everything they can to keep themselves, their community, and their workers safe during these unprecedented challenges. But I want to be clear, you are doing the right thing. By following health orders, you're helping nurses, you're helping doctors, you're helping ensure that our healthcare system can continue to operate and provide the critical supports and services that we need. You're doing your part, and we really appreciate it. and we're here today to say that we have your back. It's why we have fast-tracked a program designed to help those businesses directly impacted by the recent health order closures. Beginning this morning, applications are now open for COVID-19 Closure Relief Grant Program. Our government remains committed to continuing to support businesses and people as we navigate through better days. This means businesses currently ordered closed, like bars, lounges, nightclubs, gyms, and fitness centers, can apply for grants starting today to help pay for some of the bills such as rent, employee wages, insurance, maintenance, and utilities. Please visit gov.bc.ca/business relief grant to apply. This $10 million grant program is designed to complement the existing federal government programs. For instance, a gym with 5 employees could receive up to $5,000 of non-repayable grant with the COVID relief grant program. And because of the recent changes by the federal government, could also receive wage and rent supports for up to 75% through the federal government's local lockdown program. And their employees can now apply for the federal worker lockdown benefit, which they can receive up to $300 a week for income support. I want to personally thank all the businesses that have complied with the provincial health officer's orders. I know it's a very difficult thing to do, especially now. As you know, over the last week, the provincial health office ordered that all businesses reinstate COVID-19 safety plans. These plans provide an extra layer of protection for staff and customers. By making such measures, we're doing what we can to ensure that businesses can continue to operate in a good way. If you are a business owner and need to learn more about COVID safety plans, or would you like more information, you can reach out and more resources are available. WorkSafe BC website has full list of measures that can be taken to help reduce workplace transmissions. You can also visit smallbusiness.ca for helpful resources. It goes without saying that 2021 was a very, very tough year for the business community. Your strength, determination, and kindness has led us through these challenging times. Despite the hardships of COVID and significant weather events, BC has added more than 100,000 new jobs in this province last year. We continue to have one of the lowest unemployment rates in the entire country, and hopefully soon we will all be able to ready and visit our favorite restaurants and favorite gyms and other facilities that have been closed. The COVID-19 Closure Relief Grant will help make sure local businesses who have been impacted can get back to normal in a safe way. These businesses are important members of our local communities and provide jobs to thousands of British Columbians. So please give them the support if you can while they're closed. They need us more than they need us just as much as we need them. We will get through this together, and we know we can because we've gone through this in 4 waves. And with that, I'm happy to take any questions that may come.
Thank you. As a reminder to reporters on the phone, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. Please also remember to take your phone off mute as you are not audible until your name is called. Our first question is from Rob Shaw, Tech News. Rob, please go ahead.
Open. I mean, it's 20 days since you announced the program. There's only 6 days before the restrictions are supposed to lift, even though we know.
Rob, can you please start your question again, please?
Okay. Sorry, I'm just wondering if you can respond to criticism that it's taken a while for you to open these applications, and if you could have done it faster.
Thanks for your question, Rob. We were able to, in fact, announce the funding supports within 48 hours, getting everything approved. And now we have the process up in place. We're hiring staff. And we're actually in the process of launching the website, which is launched today. And businesses that have already gone through the program will be fast-tracked because we have a lot of the information of businesses that are impacted. And so we'll be able to fast-track their applications. And, of course, there'll be some new businesses that have opened during the pandemic, and these supports are available for them. We've also been working closely with the federal government, which we have from the beginning of the pandemic, to ensure that any programs that we launch are aligned with the programs that they have, so that there's no overlap. We're not duplicating programs, and all those pieces have been put in place in a very quick way. And I want to thank the civil service who have worked throughout the holidays to get these programs up, to get staff hired. It means a lot to many of the businesses who are impacted, who need these supports as fast as possible.
Rob, do you have a follow-up?
Sure, thanks. Are there any improvements to the federal programs that BC would like to see and has asked for?
We had asked for some additional supports, some changes, and we're very grateful that they've made them. And now businesses that are closed, gyms and nightclubs, can actually benefit for up to 75% of the wage subsidies as well as the rent subsidies, and that's on top of the direct grants, the non-repayable grants that we're providing today. And so coupled with the two things together, I know that will help a lot of the businesses that have been impacted by closures here in British Columbia. Of course, that's in addition with all the supports we've brought in place in the previous year to support many of our businesses which are going through a very challenging time.
Our next question is from Lisa Yuzda, City News.
The question I needed to ask has been punted to another ministry, so I'm sorry. Thank you.
Our next question is from Binder Sajjan, CTV.
Hi, Minister. Just following up on what Rob asked there, what good is announcing a grant program within 48 hours of the announced closures if the program doesn't even begin to accept applications until 3 weeks later? Is that acceptable to you? And how can it still take so long, given that BC has had similar grant programs in the past?
Well, it's vitally important for businesses to know how much they would be eligible for so they can plan during a challenging time. And that's why it was so important to be able to announce those dollars right away. So businesses knew, okay, by the size of my employees, how many employees I have, this is how much money I'm going to have, so they could plan. Of course, now with the wage subsidy piece that's added, the rent subsidy piece that's added to the federal program, that's a very encompassing program that will support many businesses. And I know, having talked to businesses for the last week and workers that are impacted, that these two measures will go a long way and perhaps might not address all the challenges, but certainly it's welcome news by stakeholders that we've been working with.
Binder, do you have a follow-up?
Yes, and I'm just wondering, if somebody applies today, how soon can they expect to receive money?
Well, we understand the importance of getting this money to businesses as quick as possible. Businesses that have already come through the program, which is a large portion of the businesses that we expect will apply, will be able to get fast-tracked because we have a lot of their banking information already, and so we'll be able to fast-track that within a few weeks. And of course, the federal programs have come online, so we're helping businesses get access to those programs as well. But I think it's also important for me to note that businesses that have not followed the health orders and have refused to close down their businesses are not eligible for the grants that we're announcing today. And we have built in an auditing system to ensure those businesses that have defied orders will not be able to get access to these supports.
Richard Zussman, Global News. Cordasco, Vancouver Sun.
Thank you. When your grant program was first announced, the closures were set to expire on January the 18th. But yesterday, Dr. Henry said that the restrictions will remain in place for now. So how does that affect your grant program?
Well, the grant program is in a response to the order from Dr. Henry on the closures of businesses. Of course, the decision on removing restrictions or adding restrictions are decisions that come from Dr. Henry and the Provincial Health Office. And of course, if for some reason those health orders are extended, certainly we'll be ensuring that the supports that businesses need for that additional time are available. But at this time, those are decisions that Dr. Henry and the Provincial Health Office make, and we'll continue to engage with them as the results of the pandemic continue to unfold.
Lisa, do you have a follow-up?
Yes, thank you, Minister. Do you know how many of the businesses that have applied for grants or programs before are eligible for this grant? And how are you assessing the impact of your grant? What impact that will make, and will that analysis be made public?
Yeah, so we expect from the previous data that we have from the grant intake process that we get up to 2,600 to 3,000 businesses that may apply. Of course, we may see more than that, and we're prepared to increase the financial supports, the dollars that are required to support businesses. And of course, the programs that we've put in place actually are very streamlined and with the rest of the provinces across the country. In fact, we have one of the highest per capita supports for people and businesses in the entire country. Not only were we able to provide over $500 million of grants last year, we also are one of the only jurisdictions that brought in a food delivery cap for our businesses. We brought in a reduction of 25% of liquor pricing, and of course, many measures that we've put in place to support businesses through a very challenging time. And I'm sure there'll be a big discussion past the pandemic to look at the supports and whether they were adequate or not. That's a discussion we're going to have, but I can tell you that those that I speak to in the business community are very grateful for the supports that we've been able to provide here in British Columbia.
Marcella Bernando, CBC.
You touched on this a bit, but you mentioned that businesses that have not been complying with orders are now going to be denied funding. Can you elaborate on that?
Yes, businesses that have not followed the health orders, the orders that Dr. Henry have laid out, are not eligible for this business relief grant. We have built in an auditing process for those businesses that have chosen not to follow the orders, and we're going to follow through on that. And so to those majority of businesses that have followed the orders, this grant is available. We're here to support you. The federal government programs are available.
Marcella, do you have a follow-up?
I do. I was just hoping to see if you could maybe explain if it's worth their while. Are the grants large enough that it would be less than what they would be making just by staying open?
Well, between the grants and the up to 75% wage subsidy, up to the 75% rent subsidy, certainly it will come close. I think what's clear from my conversations with many in the gym sector in particular is, of course, they want to be open. Of course, they want to see their patrons. I spent my life in the gym, been a former athlete. I know how important it is for not only to go there as a place for physical health, but also mental health. And so, of course, when it's safe to do so, we want to see those businesses open. But in the meantime, these supports are important. I think they're welcomed, and we're going to continue to work closely with them as things evolve.
Richard Sussman, Global News.
Minister, you keep saying it's going to come close. How close is it going to come? Like, is there a commitment that it will be 70% of what they would normally make, 80%? Like, what's the commitment here about how much this will cover?
Well, it's really hard to judge because every business is different. They all have different business models. They all offer services in a different way to different types of clients. And so it's really difficult to assess. Even the fitness industry can tell you they have very small gyms that operate for a few people, and then they have very large ones that are operating to hundreds. But everybody will see a benefit in proportion of their size of their operation. The federal government programs are scaled according to how much revenues businesses see and their overhead. Ours are by employees, which is what we've done from the beginning of the pandemic, and of course is similar to what other provinces have been doing across the country.
Richard, do you have a follow-up?
As you're acutely aware, many gyms believe they can operate safely with COVID safety plans. I know that's a decision from Dr. Henry, but is there any sense that you're getting from public health is that they could be reopened soon? And, you mentioned some of those larger gyms. We're hearing some of them are losing upwards of $20,000 a month or more. Like, is this anywhere close to being enough for what people need? Why not just provide a hard percentage saying we're going to cover 75% of your costs in order to continue operating?
Yeah, many of the assessments made by fitness centers in particular haven't actually, to this point, considered the new federal supports, the new parameters of the federal supports. I know that the rent subsidy and the wage subsidy, when it's calculated in, is going to have a big impact. And of course, these grants are non-repayable, and they can be used for anything that the business thinks is necessary at this time. And so we have expanded that. It has been complementary to the federal government's support. And I do think it's going to make a big impact for businesses. And of course, we hope that when it's safe to do so, that we'll be able to see some of those restrictions eased so that people can go back to gyms and work and take care of their physical and mental health.
Cole Schussler, Black Press.
Hi, thanks for taking my question. Minister, do you have any words for business owners who have chosen to remain open in spite of the public health orders?
Yeah, I would say to those businesses that it's disappointing. It's disappointing for those businesses that have chosen to defy health orders. These orders are not done lightly, and they're done to ensure that our community can stay safe so that we can protect our healthcare system for not only those that are needing supports during COVID, but others that are going to the healthcare system for whatever needs they have. It's not easy decisions. I support the decisions that Dr. Henry and the Provincial Health Office have made, and I know that the majority of businesses are doing the right thing, and even they don't like the fact that there's businesses that are defying orders when they are all following the rules. And so my message to them is thank you to those that are following the orders. These grants are available to you, non-repayable grants, and those that are not, unfortunately, these grants are not available for you.
Cole, do you have a follow-up?
Yeah, I know that you've been asked this already before, but given that the order is set to expire in 6 days, this kind of does send a bit of a signal that maybe the order could be extended. Have you been included in any conversations, or are you aware of any conversations around the order being extended beyond January 8th?
I certainly don't want to be sending any signals about any extensions. That is not something that myself or our ministry has any involvement in. Usually we hear very shortly before the provincial health orders come in place. To date today, I haven't heard of any changes that they're contemplating or any extensions that they're contemplating. So it's a question that perhaps is better suited for Dr. Henry and Provincial Health Office.
Shannon Waters, BC Today.
Thank you for listening to Depictions Media Radio.
And welcome back to Depictions Media Radio. Of course, I am your host, Michael Clogs. And the WHO has been reporting on this pandemic for quite some time. They've been gathering data, seeing how the vaccines work, different measures work in order to curb the spread of COVID-19 and to treat patients who have COVID-19 and wind up in the hospital so that they recover quickly and more fully. We've heard about the effects of what is now called long COVID, where organs have not quite recovered, and there's been symptoms to follow along with that, the least of which is fatigue. In which case, some of those patients haven't been able to back to a full normal life. They found their own new normal because of COVID-19 and the effects it had on their bodies. So they've reported on the different variants of concern and how they have spread around, and now we're up to the new Omicron variant, which has put British Columbia and other provinces in Canada into a lockdown situation. It has caused Quebec to levy a tax against those who are unvaccinated. And this new variant is putting a lot of fear into people. So there, of course, there's good news and there's bad news with the latest opening statements from the WHO, Dr. Tedros, where he says that last week more than 15 million new cases of COVID-19 were reported to the WHO from around the world, by far the most cases reported in a single week. As we know, this is an underestimate. This is a huge spike in infections being driven by the Omicron variant, which is rapidly replacing the Delta variant in almost all countries. However, the number of weekly reported deaths has remained stable since October last year, at an average of 48,000 deaths a week. While the number of patients being hospitalized is increasing in most countries, it is not the level we've seen in previous waves. This is probably due to the reduced severity of Omicron, as well as widespread immunity from vaccination or previous infection. So, of course, like I said, good news, bad news, spike in cases, but the number of deaths is not spiking along with the number of new cases. So let's listen to what the WHO and Dr. Tedros and his team actually have to say with the latest press conference as they answer questions for the media.
Hello and good afternoon. Welcome to today's update on COVID-19 and other health emergencies here from Geneva. My name is Christian Lindmer. I'm welcoming you today. Sorry for the little mishap of having sent the wrong codes to you, but we hope that by now everybody has joined, which is why we started a bit later, to give every one of you the opportunity to join with the right codes. So again, thank you very much for joining and apologies for the mishap. Simultaneous translation is again provided in the 6 official UN languages: Arabic, Chinese, French, English, Spanish, and Russian. And we have Portuguese and Hindi additionally. Now let me introduce the participants in the room. Of course, first we have Dr. Tedros Adhanom Ghebreyesus, WHO Director General, Dr. Mike Ryan, Executive Director for WHO's Health Emergencies Program, Dr. Maria Van Kerkhove, Technical Lead on COVID-19, Dr. Bruce Aylward, Senior Advisor to the Director General and the Lead on ACT Accelerator. We have also Dr. Kate O'Brien, Director for Immunization, Vaccines and Biologicals. We have a number of colleagues online as well, and we're being joined by Dr. Soumya Swaminathan, Chief Scientist, Dr. Mariangela Simao, Assistant Director General for Access to Medicines and Health Products, Dr. Rogerio Gaspar, Director for Regulation and Prequalification, and last but not least, Dr. Sylvie Briand, Director for Global Infectious Hazards Preparedness. With this, we're ready to go, and I'm handing to the Director General for the opening remarks.
Thank you, Christian. Good morning, good afternoon, and good evening. Last week, more than 15 million new cases of COVID-19 were reported to WHO from around the world. By far, the most cases reported in a single week. And we know this is an underestimate. This huge spike in infections is being driven by the Omicron variant, which is rapidly replacing Delta in almost all countries. However, the number of weekly reported deaths has remained stable since October last year, at an average of 48,000 deaths a week. While the number of patients being hospitalized is increasing in most countries, it's not at the level seen in previous waves. This is possibly due to the reduced severity of Omicron, as well as widespread immunity from vaccination or previous infection. But let's be clear, while Omicron causes less severe disease than Delta, it remains a dangerous virus, particularly for those who are unvaccinated. Almost 50,000 deaths a week is 50,000 deaths too many. Learning to live with this virus does not mean we can or should accept this number of deaths. We must not allow this virus a free ride or wave the white flag, especially when so many people around the world remain unvaccinated. In Africa, more than 85% of people are yet to receive a single dose of vaccine. We cannot end the acute phase of the pandemic unless we close this gap. We're making progress. In December, COVAX shipped more than double the number of doses it shipped in November, and in the coming days, we expect COVAX to ship its 1 billionth vaccine dose. Some of the supply constraints we faced last year are now starting to ease, but we still have a long way to go to reach our target of vaccinating 70% of the population of every country by the middle of this year. 90 countries have still not reached the 40% target, and 36 of those countries have vaccinated less than 10% of their populations. WHO and our partners are actively supporting these countries to overcome the bottlenecks they face in leadership and coordination, lack of supply visibility, short shelf life of donated vaccines, limited cold chain capacity, vaccine confidence, health worker shortage, and competing priorities. WHO is also paying careful attention to the impact of Omicron on vaccines. In September last year, WHO established the Technical Advisory Group on COVID-19 Vaccine Composition, or TAC-COVAC, a group of experts to review the implications of variants of concern on the composition of vaccines. Yesterday, TAC-COVAC emphasized the urgent need for broader access to the vaccines we have, and that further vaccines are needed that have a greater impact on preventing infection and transmission. Until such vaccines are developed, the composition of current COVID-19 vaccines may need to be updated to ensure they continue to provide WHO-recommended levels of protection against infection and disease. TAC-COVAC also said that a vaccination strategy based on repeated booster doses of the original vaccine composition is unlikely to be sustainable. The group also emphasized that while some countries recommend boosters, the immediate priority for the world is accelerating access to primary vaccination, particularly for groups at greater risk of developing severe disease. The overwhelming majority of people admitted to hospitals around the world are unvaccinated. While vaccines remain very effective at preventing severe disease and death, they do not fully prevent transmission. More transmission means more hospitalizations, more deaths, more people off work, including teachers and health workers, and more risk of another variant emerging that's even more transmissible and more deadly than Omicron. The sheer number of cases also means more pressure on already overburdened and exhausted health workers. Protecting those most at risk also helps to protect health systems and health workers. which are once again under increased strain because of the burden of Omicron. A study published last year showed that more than 1 in 4 health workers globally have experienced mental health issues during the pandemic. And data from several countries show that many health workers have considered leaving or have left their jobs because of poor working conditions, insufficient staffing, and the distress of making life and death decisions every day under intense pressure. Health workers have done their best to protect us for 2 years. We must all do our part to protect them by getting vaccinated and by taking precautions to prevent becoming infected or infecting someone else. And we must remember that COVID-19 is only one challenge that health workers face every day. Taking the pressure off health systems will enable them to deal with the many other challenges they face, including providing care for pregnant women. Yesterday, WHO hosted a global webinar attended by clinicians from around the world on the clinical management of COVID-19 during pregnancy, childbirth, and the early postnatal period. Pregnant women are not a higher risk of contracting COVID-19, but if they're infected, they're at higher risk for severe disease. That's why it's vital that pregnant women in all countries have access to vaccines to protect their own lives and those of their babies. We also call for pregnant women to be included in clinical trials for new treatments and vaccines. Fortunately, mother-to-baby transmission in utero or during birth is very rare, and no active virus has been identified in breast milk. We're also concerned by reports from some countries about women who have been separated from their newborn babies, which is unnecessary and can be harmful to the health and well-being of newborns during the critical first days after birth. All women have the right to a safe and positive pregnancy and childbirth experience and need high-quality, respectful maternity care. Christian, back to you.
Thank you very much, Dr. Tedros. Let me now open the floor to questions from the media.
Yeah, thanks a lot for taking my question. As Dr. Tedros just mentioned, there are 36 countries in the world that have less than 10% of their population vaccinated.
Yes. Can I ask you to speak up a bit, because it's really hard to understand?
Yes. Okay, I'll talk louder. I hope this is better.
That's good.
As Dr. Tedros just mentioned, there are 36 countries that have less than 10% of their populations fully vaccinated. We have heard a lot about access to vaccine as a barrier, but I'm wondering if you can talk a bit more about particularly those countries that have really struggled to get above 10% vaccinated, and what are some of the other issues that are leading to some of these low vaccination rates?
Thank you very much, and I think we'll start with Dr. Mike Ryan. No? Oh, Kate O'Brien, of course, the Director for Immunization, Vaccines and Biologicals.
Thanks so much for this question. This is such a critical issue because countries that are struggling to get even above 10%, what this really means is that healthcare workers are not fully vaccinated yet. It means that those who are in older age populations, those who have underlying medical conditions, these are the people at highest risk, are not fully protected yet. And so the reasons for countries which are below 10% are actually quite a wide range of reasons. First and foremost, the reason is around supply that has been constrained, as you well know, over this past year. And any vaccine program is going to struggle to stand up a program if it doesn't know when it's getting doses, how many doses, of which product. So that is sort of the underpinning, the sort of foundational issue that many countries are struggling with. But beyond that, there are a number of issues. And these are in no particular order, but are a range of things that countries struggle with. The first is on financing. A campaign like a COVID vaccine campaign does require funding to deploy to new health workers, to assure that the clinics have the resources that they need, the campaigns have the resources. And securing the funding in a timely and in a predictable way is really important. The second is that many of these countries have weak health systems to start with, or are in conflict settings or in fragile settings. There may be humanitarian emergencies, there may be other issues that the country is struggling with. And so to add on to the deployment of all health services, these other things, healthcare workers who are the ones who need to actually deploy vaccines. Countries are also facing concerns from populations about the vaccines that are being received and deployed into countries. And we've seen a lot of different countries making choices around vaccines. And these are issues of concern to people in the country as well. The other thing is the really strong commitment from leadership of countries around what their targets are, and having decisions in countries about exactly what the targets will be in what time frame. And that's what I think is so helpful about the targets that have been set by WHO to help guide countries around what the trajectory might be. And then a couple of other things that I would mention is certainly the cold chain capacity, where there have been a lot of investments to help countries increase that cold chain capacity to be able to secure not only what is needed for these vaccines, but for other commodities that are coming through in the country. So these are a range of issues that there's no one specific problem that is across all of the countries. It really is a country-by-country tailoring of understanding exactly what the country needs to be able to help the country accelerate vaccination. And we have seen that acceleration, especially when supply is secured and is in a predictable way. Many of the other pieces fall into place.
Thank you very much. And Dr. Bruce Aylward, please.
Thank you very much, Christian. And Jason, thanks for this really important question, because there's a dangerous narrative emerging in many high-income and high-coverage countries about the low vaccination rates in some lower-income countries or countries with weak immunization or health systems. And that narrative is, you're hearing more and more, is countries can't use these vaccines, or countries don't want these vaccines, as you mentioned. And so there's 2 points just to emphasize further to what Kate said, Jason. The first is, if you look at those maps and then look at a map of polio around the world or measles, and you'll see that the same countries that have got very low coverage for COVID-19 have eliminated or eradicated polio or eliminated measles or achieved very high routine immunization from other diseases. And so then, Jason, we got to stand back and say, okay, why is that? And a big part of the problem is we've made it twice as hard or 3 times as hard for low-income countries, many of them, to be able to achieve high coverage. We have to be really clear on that. Well, we did not share vaccines for 6 months, 7 months, 8 months. What we did share was a lot of misinformation, a lot of bad practice, a lot of problems. So now, as we are starting to get vaccines, and huge recognition of the work of COVAX, as the Director General mentioned, that the organizations working together will have shipped nearly 1 billion doses, 980 million doses as of today. So watch that number. But that demonstrates COVAX can deliver and deliver at scale. scale and get vaccines to these countries. But the challenge we have now is it's very late. And these countries have a much more difficult problem because they're dealing with the challenges around information. They've not had the investments always in the financing side, as Kate said. And then they've also had the problems associated with some of the donated products. Some countries are sending vaccines that they don't want, and low-income countries know that, and then they have to work with their own populations. They're getting vaccines that have got short expiry dates, which make them very, very difficult to use in complex environments, and expiry dates that are shorter than the countries donating them will actually accept themselves often. So I just want to be very frank, Jason, that these are countries that have, many of them that are red on the map, have achieved very high coverage for immunization against other diseases and eradicate and eliminate diseases. They know how to run vaccination at scale. It's really tough environment they're operating in right now. How do we fix that? Number one, we have to provide full support, the financing for the delivery, the information support, the right products, the right timeframes. There's so much we can do because these countries know how to get to their populations. They know how to turn on the machinery. They know how to get people vaccinated. They have a fantastic track record, most of them.
Thank you very much, both. Next question goes to Jamil Shad from O Estado de Sao Paulo. Jamil, please unmute yourself.
Yes, hello to everyone. My question, if you allow, Christian, will be in Portuguese because I have to read a statement by President Bolsonaro on Omicron. Is that okay if I do it in Portuguese?
Let us try if that works. Yes, please. We should have Portuguese translation.
Very good. So the statement is by President Bolsonaro made today. Omicron já espalhou pelo mundo todo, como as próprias pessoas que entendem de verdade dizem, que ela tem uma capacidade de difundir muito grande, mas a letalidade muito pequena. Dizem até que seria um vírus vacinal, segundo algumas pessoas estudiosas e sérias e não vinculadas às empresas farmacêuticas, dizem que a Omicron é bem-vinda e pode sim sinalizar o fim da pandemia. E que a variante não tem matado ninguém. My question to you, the fact that President Bolsonaro claims that it has not killed anyone, that Omicron has not killed anyone, and that it could be a vaccinal virus and is welcome, is this a statement that, let's say, tranquilizes you all? Thank you.
Jamil, can I ask you to repeat your question as such, please, because we're not quite clear what you're asking.
My question is Omicron welcome, as said by President Bolsonaro today? And is it true that it has not killed anyone?
Thank you very much. I'm asking Dr. Mike Ryan to start.
Sorry, thank you. No, I'm not aware of any such statements, but I think the Director General was clear in his remarks that while Omicron may be less severe as an individual virus infection in an individual, that this does not mean this is a mild disease. And there are many, many people around the world as we speak in hospital, in ICUs, on ventilators, gasping for their breath, on oxygen, who would obviously be very clear that this is not a mild disease.
Thank you for listening to Depictions Media Radio. Welcome back, everybody, to Depictions Media Radio. Of course, I am your host, Michael Clogs. And for a few weeks, we have been listening to about the Omicron variant and how it is more or less becoming the more dominant strain of COVID-19 and the measures that are being taken to curb the spread of it and the effectiveness of vaccines against it, and more recently we're learning that Quebec has imposed a tax against unvaccinated people if they wind up needing medical care due to COVID-19 and the Omicron variant. And there are some questions about that. That are they being discriminatory and singling out unvaccinated people unfairly with this new tax that they are levying against people who are unvaccinated? There's a lot of questions around that. There are other measures that are being taken across Canada and of course into the United States. There have been introduced new travel restrictions, and other things are going on throughout North and South America, especially with cases nearly doubling with the Omicron variant. So in this next segment, we're going to listen to Dr. Etienne and the team at the Pan American Health Organization and hear what PAHO is suggesting to countries and to different public health organizations about the Omicron variant, because this new variant has now been found in over 42 countries, and a lot of them are in the Americas. So let's listen to what Dr. Etienne and her team have to say.
Good afternoon to all of you. Welcome to the first press briefing of 2022 here at the Pan American Health Organization, PAHO, on the COVID-19 pandemic in the Americas. My name is Luciana Viegas. I am advisor on public affairs with PAHO, and today is Wednesday, January 12th, 2022. As usual, we have interpretation into English, Portuguese, French, and Spanish, and you can choose the interpretation button at the bottom of the screen. You can also ask questions during the session using the Q&A button, and also we have received some of your questions via email, and we will be starting with those. Please remember that journalists need to indicate their name and media outlet when asking the question. Dr. Carissa Etienne, PAHO's director, will be updating you today on the situation of COVID-19 and also the spread of Omicron in the Americas. Together with Dr. Etienne, we have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Sylvain Adgueri, Director of Health Emergencies, Dr. Silvana Aldiguieri, Incident Manager, and Ciro Ugarte, who is the Director of Health Emergencies. And now I give the floor to Dr. Etienne.
And good morning. Let me wish each of you a Happy New Year. And thank you for joining our first press briefing of 2022. Since the start of this pandemic, nearly 300 million people around the world have been infected with COVID-19. And the virus has quickly picked up pace over the holiday season, reaching levels of transmission never seen before during this pandemic. Over the past week, COVID infections have nearly doubled in the region of the Americas, rising from 3.4 million on January 1st to 6.1 million on January 8th. To compare with last year, during the week ending January 8, 2021, the Americas had reported a total of 2.4 million cases, while this year, by the same date, there were 6 million reported cases, representing a 250% increase year to year. Infections are accelerating across every corner of the Americas. And once again, our health systems are being challenged as emergency room visits and hospitalizations are rising. Nonetheless, thanks to the protective power of vaccines, in fact, COVID deaths are not rising with the current wave of infections. The United States is reporting the bulk of new cases, where its eastern and midwestern states are experiencing a rapid surge. In Canada, cases are also picking up speed in its eastern provinces. In the Caribbean, Puerto Rico and the Dominican Republic are reporting the highest numbers of new infections, although other islands like Jamaica, Aruba, Curacao, and Martinique are also seeing significant jumps in COVID cases. Meanwhile, Belize and Panama are reporting the highest incidence of COVID in Central America. Further south, Bolivia, Ecuador, Peru, and Brazil are experiencing significant increases in new cases. COVID hospitalizations are also up throughout Brazil, particularly in densely populated states around the central and eastern parts of the country. In Argentina and Paraguay, COVID infections have increased by nearly 300% over the last week. Today, of course, all eyes are on Omicron, which has reached nearly every country in the world. 42 countries and territories in all subregions of the Americas, North America, Central America, South America, and the Caribbean have already detected the Omicron variant. Since countries are already experiencing widespread community transmission, as Omicron spreads more quickly than other detected variants, and more likely via airborne transmission in closed spaces. And while Delta is still causing new infections in the Americas, based on current trends, Omicron is on track to become the dominant strain in our region. It also has led to a rise in reinfections, even among those who are fully vaccinated. This new wave of infections, it won't be mild for our health systems, as the Omicron variant is already challenging our health workforce and limiting care for other diseases. In smaller island states, some hospitals were already strained by cases of the Delta variant, and now more hospitals face the prospect of being overwhelmed with cases. One of the characteristics that sets Omicron apart seems to be less severe symptoms. But even so, Omicron infections can be lethal, especially for the immunocompromised and the unvaccinated. So the time to act is now, using the many tools that we now have at hand. Prioritizing symptomatic individuals for testing and making rational use of these resources is critical to catch infections quickly and early. Maintaining and reinforcing the public health measures is paramount to slow transmission. The PCR and rapid antigen tests recommended by PAHO remain effective at detecting the Omicron variant. So countries should continue to use existing protocols with rational use of tests. PAHO's strategic fund makes COVID tests available at low prices, so countries should take advantage of this resource. Vaccines are especially important as Omicron takes hold. Countries in the Americas have been working diligently to secure the vaccines that they need to protect their population. And thanks to their efforts, nearly 60% of people in Latin America and the Caribbean have been fully vaccinated with 2 doses. And many countries in our region, like Chile, Cuba, and Argentina, have some of the highest vaccination coverage rates in the world. Vaccines are helping to save lives, and expanding equitable coverage everywhere remains our priority. WHO's expert group, the SAGE, has also called for vaccination strategies optimized for prevention of severe disease, including the targeted use of booster vaccination. This applies to people at high risk of complications and healthcare workers who are more exposed to the virus. We must continue to protect our health workers. Our region's ability to respond and overcome this pandemic depends on men and women who staff our primary healthcare centers, clinics, and hospitals. As health professionals everywhere handle the influx of new cases requiring immediate care, we must make sure that they are protected from the worst consequences of this virus. Wherever enough vaccines are available, health workers should be prioritized for an additional COVID vaccine dose. Additional doses are safe and effective and will help reinforce health workers' ability to withstand exposure to the virus, especially now that infections are rising. 39 countries and territories in the Americas have been rolling out additional doses to ensure their populations, including health workers, remain protected. But protecting our health workers cannot stop there. We urge countries to ensure that they have the right protective equipment so our health workers can do their job safely. With a virus as transmissible as this one, effective and well-fitted masks help us all stay safe. So we urge countries to provide their health workers with the PAHO WHO recommended protective equipment, including masks, with the highest filtration capacity. While COVID continues to spread in our region, we remind everyone that our goal has always been to protect each other from the most serious symptoms so we can save lives and prevent deaths from COVID infections. And saving lives remains our highest priority. Once again, we must slow down new infections to avoid overwhelming our health systems. Governments must act guided by evidence to limit new infections. And we all have a personal responsibility to keep each other safe by following proven public health measures like mask wearing, social distancing, and avoiding large gatherings, by getting vaccinated when it's our turn, and by getting tested if we suspect that we are sick. Our collective actions against this virus have the power to change its course. Whether we are fighting for vaccine equity, supporting our health workers, or doing our part to reduce the risk of transmission, solidarity will pave our way out of the pandemic. Thanks for listening.
Thank you very much, Dr. Tien. We start with a general question that we received from a couple of media. As we enter 2022 and the third year of the pandemic, what are PAHO's priorities for the year? Dr. Tien?
Well, let me thank you for this question. For 2022, our priorities are to protect the gains that we have made against COVID-19 in the last 2 years by helping the countries develop their surge capacities to treat patients and helping them continue to roll out vaccination campaigns. Both of these have proven to help reduce mortality in the region. And our challenge now, I think, is to deal with the rapidly evolving situation of COVID-19. We must also, I believe, advocate for maintaining the discipline of the important public health and social measures that have helped limit transmission. The key public health measures we continue to recommend include the use of well-fitting masks, physical distancing, ventilation of indoor spaces, avoidance of crowded spaces, especially during parties or celebrations, and also hand hygiene. This will help reduce transmission of SARS-CoV-2, including its Omicron variant. Because the emergence of new variants is a key factor, we also have to strengthen our virus surveillance systems in the region and to give them the tools to rapidly report any new data to our regional and global systems such as GISAID or GSAID. Another challenge is to prepare our primary healthcare systems to handle and fairly distribute any new therapeutic or treatments that may become available in our countries. And of course, it is important to continue and to intensify our successful vaccination programs to reach at least 70% and hopefully much more than that of our eligible populations, with rational implementation of immunization protocols, including the additional doses or boosters to protect people at high risk and to protect our health workers. This would require, of necessity, our working with member states to address vaccine hesitancy, which is very present, particularly in the Caribbean islands. Thanks.
Thank you, Dr. Etienne. Pasamos a las próximas preguntas. Empezamos con.
We now move on to the next question. We have a question on Omicron. We have a question from Turk and Caicos.
How describe the rate of breakthrough infections due, it appears, to Omicron, and what percentages of cases are Omicron or Delta? And if PAHO is offering any support in terms of testing kits and materials to countries. Dr. Altigeri.
Yes, thank you from this series of questions from the Bahamas. I'd like to mention that thanks to the active participation of most of the national laboratories, public health laboratories in the region, in the PAHO Genomic Surveillance Network, and the sustained efforts of the countries to generate timely data, we have been able to follow the distribution and circulation of different variants, including those of concern, and including the Omicron variant. So, although the Delta variant is still predominating in the Americas, and as Dr. Etienne said in her remarks, as of today, Omicron has been detected in 42 countries and territories. Omicron is probably going to become predominant during the next weeks. Regarding the support of PAHO, PAHO has provided testing kits and materials since the beginning of the outbreak, very early 2020, starting February 2020. And PAHO has continually maintained the support to all member states to ensure the detection and the timely diagnostic of COVID-19. Just to provide you with some figures, as of today, in addition of the PAHO strategic funds, PAHO has donated reagents for more than 12 million PCR tests and more than 3 million antigen rapid detection tests. In addition, sequencing materials for the genomic surveillance and molecular screening to detect the variant of concerns has been delivered to more than 22 countries. Another part of the questions. For different reasons, it's difficult to accurately describe and follow the COVID-19 breakthrough. Although individuals already vaccinated can get infected, they are usually asymptomatic or they develop mild disease, preventing them to seek medical attentions and getting tested. Even if a virus is detected, not all cases will be sequenced. So confirming variants in the affected population might be challenging. Evidence shows that breakthrough may occur with Omicron in higher frequency. Nevertheless, it is important to remember that other variants of concerns, including, of course, the highly transmissible Delta, can also infect vaccinated people. Therefore, as we have explained in many other press conferences and technical documents and communications and press release, maintaining public health measures, including social distancing and proper use of masks, in addition to vaccination, is critical to slow down the transmission. I hope I have answered the concerns from the journalist in the Bahamas. Thank you.
Thank you, Dr. Aldigueri. Pasamos a una pregunta de Estefania Escobar.
We move on to a question by Stefania Escobar, who is a reporter with Diario Reforma in Mexico. She has a comment on the implementation of the health passports in some countries, in particular in connection with the discrimination that this could result in, for example, excluding individuals that cannot travel because of some pharmaceuticals that are not allowed in the United States or in Europe. Thank you very much for the question. This is Dr. Barbosa. We now have about 60% of the population that has already been vaccinated in Latin America, but there is great inequality. We have some countries that are the ones that vaccinate the most in the country. We have Chile, Cuba, Canada, Uruguay, and Argentina that have vaccinated more than 75% of the population, but we still have 10 countries that have been unable to vaccinate 40% of the population that was the target by December 2021. Health passports, and some have already mentioned that we already need an agreement among the countries for PAHO and WHO to discuss this recommendation or to make that recommendation. The agreement that the countries have nowadays as to the vaccine that may be mandatory is the yellow fever vaccine, and we understand because it is why it is difficult to reach consensus, because many countries in the world have no access to vaccines in a broader fashion. So to make a representation on passports for vaccination and also the mandatory nature of vaccination may be a factor to increase inequality and difficulty in access for the countries. This is a difficult decision to make, and the countries also need to remember that this is not an isolated measure, the one that could lead to protection, because first, the vaccinated individuals may also be the source of transmission for COVID in a more mitigated fashion, but they do continue with transmission. So we need to have broader measures to reduce, in fact, the risk of introducing new variants in a country, and also to see what responses are being offered to each of the countries. So I think that this indeed is very important. And PAHO has always stated that all of the vaccine producers may present their application to be approved for emergency use by WHO. The process is also to be implemented by all of the producers who are interested in having their data validated, and this would be an important measure to have more vaccines through the revolving fund that PAHO has, and also to have more vaccines that are recognized by a higher number of countries in the world. Thank you. Thank you, Dr. Barbosa. We now move on to a question from Venezuela. Kevin Arteaga Gonzalez from El Carabubeño has two questions. The first one is, what is the level of progress made by Omicron in the countries? Is it the prevalent one? And also whether there is a general snapshot of the pandemic in Venezuela. And the second question is, how has vaccination been implemented in the country after the COVAX deliveries to the country? Dr. Ugarte, maybe you can address the snapshot of the situation with Omicron, and Dr. Barbosa could refer to vaccination. Thank you. This is Dr. Ugarte. Thank you, Luciana. Thank you, Kevin. From the very first report about the detection of the Omicron variant in Venezuela,
Thank you for listening to Depictions Media Radio.
listening to Depictions Media Radio. And, of course, I'm your host, Michael Clogs. And this next segment is the UN Secretary General is speaking about what is happening in Afghanistan. And he talks about extreme weather conditions and how the current Afghanistan government, as they're forming, because of how they view women and how they view that women should not be allowed to have an education, nor should they be, if they have an education coming into this government, that they shouldn't be allowed to use it, and how it wastes resources. It wastes human resources, in that there are problems that if we all work together, no matter if we are our views on gender, that we can all come together to help solve problems, to help fix what is wrong in our communities, and that is what is needed for our communities to become whole. And the idea of discriminating against anyone for any reason puts a real hindrance to the idea of community. And the Secretary General is going to speak about that, and because he has strong views on how everybody should be valued, and everybody should be held as a valuable part of our community. Of course, he's going to be asked questions about climate change. He will address some of that in a media answer, and there are other topics that will come up within this next press segment. So let's listen to what the UN Secretary General Antonio Guterres has to say about Afghanistan and other issues around the world.
Good morning. The Secretary General will make some remarks, and then we'll go ahead and take some questions. Sir?
Ladies and gentlemen of the media, good morning. And allow me a few words on the nightmare unfolding in Afghanistan. We are in a race against time to help the Afghan people. Just 2 days ago, the United Nations launched our largest ever humanitarian appeal for a single country. And the scale of that appeal reflects the scale of the despair. Babies being sold to feed their siblings, freezing health facilities, overflowing with malnourished children, people burning their possessions to keep warm. Livelihoods across the country have been lost. And more than half the population of Afghanistan now depends on life-saving assistance. This situation, without a more concerted effort from the international community, will make that virtually every man, woman and child in Afghanistan could face acute poverty. And all of this is happening, of course, amid a global pandemic. Our humanitarian and refugee response plans require more than $5 billion this year. The assistance is essential to ramp up life-saving food and agricultural support, health services, treatment for malnutrition, emergency shelter, water and sanitation, protection, and emergency education. These are all critical investments to help Afghans help themselves in rebuilding their lives and building a future for their children. We know that properly funded, the aid operation in Afghanistan has the capacity to achieve amazing results. Last year, the UN and its humanitarian partners reached 18 million people across the country, over 60% more than the year before. National and international aid workers helped keep food aid moving, clinics functioning, and schools open. These workers now have access to areas and communities that have been off limits for years. But humanitarian operations desperately need more money and more flexibility. Freezing temperatures and frozen assets are a lethal combination for the people of Afghanistan. Rules and conditions that prevent money from being used to save lives and the economy must be suspended in this emergency situation. International funding should be allowed to pay the salaries of public sector workers and to help Afghan institutions deliver health care, education, and other vital services. These civil servants include surgeons at major state hospitals, sanitation workers that keep disease at bay, and electrical engineers who strive to keep the lights on across the country. This kind of support for essential state functions will give Afghans hope for the future and reason to stay in their country. I welcome the Security Council's adoption of a humanitarian exception to the United Nations sanctions regime for Afghanistan. This provides financial institutions and commercial actors with legal assurances to engage with humanitarian operators without fear of breaching sanctions. For our part, the United Nations is taking steps to inject cash into the economy through creative, authorized arrangements, but it is a drop in the bucket. Jump-starting the banking system is essential to avoid economic collapse and to enable humanitarian operations. The function of Afghanistan's central bank must be preserved and assisted, and a path identified for conditional release of Afghan foreign currency reserves. We must do even more to rapidly inject liquidity into the economy and avoid a meltdown that would lead to poverty, hunger, and destitution for millions. For example, the World Bank administers a reconstruction trust fund for Afghanistan. Last month, the bank transferred $280 million from the fund to UNICEF and World Food Programme operations in the country. I hope the remaining resources, more than $1.2 billion, will become available to help Afghanistan's people survive the winter. The United Nations in Afghanistan stands ready to work with member states and others to put in place accountable systems that will enable funds to reach the Afghan people most in need and to ensure that these funds are not diverted. And as I appeal to the international community to step up support for the people of Afghanistan, I make an equally urgent plea to the Taliban leadership to recognize and protect fundamental human rights, and in particular, the rights of women and girls. Across Afghanistan, women and girls are missing from offices and classrooms. A generation of girls is seeing its hopes and dreams shattered. Women scientists, lawyers, and teachers are locked out, wasting skills and talents that will benefit the entire country and indeed the world. No country can thrive while denying the rights of half of its population. The women and girls of Afghanistan must have access to all education and employment opportunities, health care, and other essential services. The United Nations stands ready to cooperate and support the Afghan de facto authorities in making this possible with the greatest urgency. Moving forward, it is also essential that every effort is made to build inclusive government institutions in which all Afghans feel represented and that promote security and fight terrorism. Ladies and gentlemen of the press, without creative, flexible, and constructive engagement by the international community, Afghanistan's economic situation will only worsen. Despair and extremism will grow. We need to act now to prevent economic and social collapse and find ways to prevent further suffering for millions of Afghans. Thank you.
Thank you. James Bays, Al Jazeera.
Secretary General, your humanitarian chief and the head of the International Committee of the Red Cross tomorrow are meeting virtually with the US Secretary of State. What does the US need to do, and what moral duty does it have to prevent the breakdown of the financial system in Afghanistan and tell us, if you would, what such a breakdown would mean for the Afghan people.
Well, it is absolutely essential to avoid that breakdown, because with the present situation, you have Afghans on the verge of death. I'm talking concrete death on the ground because of hunger, because of disease, and because of lack of assistance. So it's absolutely essential to avoid the collapse of the economy, and for that we need to inject liquidity in the economy. Several important civil society organizations have said that without liquidity they will not be able to operate, and that means the public will be in a desperate situation. Now, the reason why these meetings will take place is exactly to create mechanisms that allow, independently of the regimes that exist of sanctions, but to allow mechanisms that allow for an effective injection of funds into the Afghan economy, and at the same time create the conditions for the financial system in Afghanistan to be able to operate in the local currency. This is absolutely essential, and this needs a number of steps to be assumed by different countries with sanctions regimes. The UN has already done its bit, and also by the international multilateral development banks.
And specifically the US and the moral duty of the US in this?
I think the US has a very important role to play, because most of the financial system in the world operates in dollars. And obviously there is a meaningful volume of funds that are frozen in the United States and in several other countries in the world. But the way to apply them in a way that is not diverted but really serves the interests of the Afghan people is something in which we are working hard to make sure that all the necessary guarantees are provided.
Thank you. Gregory?
Thank you very much. Secretary General, how can you estimate the results of talks between Russia and US and NATO on security issues? And do you have any concerns about the possibilities of confrontation? Thank you.
Obviously, I think everybody is concerned with the present escalation of tension, and it is absolutely essential that the dialogue that is taking place find a way allowing for de-escalation of tension and allowing for to avoid any kind of confrontation that would be a disaster for Europe and for the world.
Thank you. Valeria?
Thank you. Mr. Secretary General, my question is on Libya. Do you think it is realistic to have the election after Ramadan, so not before the end of May? And if so, do you think there are consequences for such a long delay? Thank you so much.
Our advisor, my advisor in Libya is working hard with the parties to create conditions for things to move as quickly as possible. There is a positive element. For the first time in many years, the House of Representatives could meet with quorum, 127 members from all over Libya, and they created a committee to prepare a roadmap. Now we will be naturally working with them in order to make sure that that roadmap allows for elections to be taken place as soon as possible, because I believe it's important to create legitimate institutions in the country.
Hi, Secretary General. This is De Zhi from China Central Television. So 2 questions. First one, we know you accepted the invitation from the IOC to participate in Beijing Winter Olympic Games. What expectation do you have for the Games, and what message do you want to convey during your visit there? Second question is on climate change, because we saw the spike of fossil fuel price recently. Some people argued it's because some countries, they adopted some more aggressive environment policy, yet it's not prepared totally. That caused the spike of the traditional fossil fuel energy price. That might slow down the speed from the recovery of the pandemic. What's your view on this? Thank you.
Well, first of all, the Olympic Games is an extremely important event, and it's an event that symbolizes the role of sports in bringing people together and in promoting peace. And it is in this strict context and without any political dimension that I intend to be present in the opening with this message that Olympic Games must be an instrument for peace in the world. In relation to climate change, if something is clear about the present energy mix in the world, is that that energy mix is broken. So the fastest we are able to have an energy transition into renewables, the less we are dependent on fossil fuels, and the permanent variation of prices of those fossil fuels for different reasons, sometimes for reasons that have nothing to do with the economy in itself, because they depend on political events, on conflicts and things of the sort. So I think what is happening is a demonstration that instead of slowing down, we must accelerate climate action.
Thank you. One last question.
Thank you. Celia from VOA. Secretary General, today the Deputy Foreign Minister Sergei Ryabkov of Russia, he was leading the talks on Russia.
I'm sorry, if you can...
I will. So the Deputy Foreign Minister of Russia, he was leading the talks in Geneva as well as in Belgium with the NATO members. He mentioned that if the talks don't go well and if negotiations fail, Russia will be able to start sending more military assets to Venezuela and Cuba. Is any concerns by your office and yourself in particular that this type of language to try to create a threat to the United States if things don't go their way?
My concern is a general one. I mean, we have seen a rhetoric escalation in the recent past. What we need is to make sure that we create conditions for peace and stability in Europe.
Thank you. And reminder, the Secretary General of the press conference. À la conférence de presse.
En français?
Êtes-vous inquiet? Pensez-vous que les sanctions qui viennent d'être votées vont contribuer à apaiser les tensions et n'avez-vous pas peur que toute la région ne s'embrase?
C'est une question qui me préoccupe énormément. Hier, j'ai eu l'occasion de parler avec les présidents du Ghana, du Sénégal, du Nigeria, avec le Moussa Faki, le président de la Commission de l'Union africaine, aussi avec le ministre des Affaires étrangères de l'Algérie, et en même temps, j'espère pouvoir entrer en contact brièvement avec le gouvernement malien. Je crois que c'est absolument essentiel que le gouvernement malien présente un calendrier acceptable du point de vue des élections et que ça puisse permettre, tenant compte de la déclaration du président du Mali, qu'il est ouvert à la coopération avec la CEDEAO, que ça puisse permettre que la décision de la CEDEAO qui établit que si le gouvernement malien présente un calendrier acceptable et prend les mesures dans cette direction, il y aura une levée progressive des sanctions. Et naturellement, je travaille avec la CEDEAO et avec l'Union africaine pour créer les conditions qui puissent permettre que le gouvernement du Mali adopte une position raisonnable et acceptable pour accélérer une transition qui dure déjà il y a longtemps et que ça puisse permettre un rétablissement de la normalité dans les relations entre cet État et la communauté internationale, la CEDEAO en particulier.
Merci. Thank you. And reminder, there's a press conference next week on Friday with a few more questions.
and the Omicron variant, and questions around the world about aid to different countries and discriminatory acts against people because of gender and, of course, race and things that could leave vulnerable groups of people open to exploitation, trafficking, and in some cases, in some countries, neglect and starvation. We as a global community and local communities should be asking ourselves questions about what is going on in our community and how we can actually help, how we can help our neighbor, how we can help the situations around the world when we have a stable footing ourselves to be able to lend a hand. You've been listening to Policy and Rights here on Depictions Media Radio. I've been your host, Michael Clogs. Go out and help others as you would want help yourself. Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information, and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.